Okay, thank you very much, council members, for making this uh, emergency meeting today. To Madam BA, the council, Madam Chief of Staff, our clerk, to everyone, and to all our directors, I want to thank you. So, Madam Clerk, I'd like to call this meeting to order.
Yes, ma'am.
Okay, roll call, please.
Yes, Madam President. Roll call for municipal council emergency meeting of April 20th, 2020 at 5 p.m. Councilman Abdelaziz, Councilwoman Cotton, Councilman Jackson,
Present, Madam Clerk.
Councilman Khalid,
Present.
Councilman McCoy, Councilman Mills.
I'm here.
Thank you. Councilman Rivera,
Here.
Councilman Durant.
Present, Madam Clerk.
Madam President.
Present. Thank you very much. Madam Clerk, can you please read the statement of compliance covering the special meeting?
Yes, Madam President. City of Paterson, notice of emergency meeting on April 20, 2020 as an exception to the requirements of Open Public Meetings Act. Be advised that the Municipal Council of the City of Paterson has scheduled an emergency meeting for Monday, April 20, 2020 at 5 p.m. to be held via webinar. The normal notice requirements of the Open Public Meetings Act have not been met. It is necessary to call this meeting pursuant to NJSA 10.4-9 because of the emergency situation that has developed. Of the urgency and important is: 1. The municipal council to convene in lieu of a board of health, discuss the worldwide coronavirus COVID-19 pandemic and the health emergency that exists in the city of Paterson. Number 2. Public portion. The public will be able to view the meeting on the City of Paterson Public Access Channel, number 77, Optimum, Channel 77, Channel 32, and the City of Paterson YouTube channel. If you wish to comment during the public portion, the number to call in is, and I'll read the number slowly, 973 321 1579, 973 321 1579, and the ID code 711 680 0071. ID code again 711 680 0071. No formal action will be taken. If a meeting of the municipal council has been delayed in order to give proper notice under the Open Public Meetings Act, a substantial health crisis might have escalated if this matter was not considered by the municipal. This meeting was called Sunday, April 19, 2020, and on that day, notice of this meeting was given by posting the notice at City Hall on 5500 Street, Paterson, New Jersey, by filing it with the City Clerk, and by sending the notice by fax to the Herald News and the Record, New Jersey Pulse, the Paterson Press, and other newspapers used for public noticing as required by NJSA 10-4-9B3. This meeting will be limited to the discussion of and/or action on the above described emerging matters. This meeting is signed by President Davila and City Clerk. Madam President, you may.
Thank you very much, Madam Clerk, for reading the statement of compliance. I am going to ask before we begin with the discussion, is this on YouTube? Is this on the Access channel? Because I'm getting people to say that they can't see it.
Okay, I'll just see a few, but it's supposed to be on YouTube and both channels. But I will put them in compliment, so you can.
All right, well, I just got 2 text messages just to say that they can't see it. That's why I'm asking.
Yes,
okay.
I will let them check it. I'll check it.
Okay. Okay, very well, Madam Clerk.
Okay, yes, so Are you
Okay,
going to
so
with item number 1?
yes, we will now proceed with the special meeting agenda. So Madam Clerk, can you please read the first item on the agenda?
Okay, item number 1 is the municipal council to convene local board of health to discuss the worldwide coronavirus COVID-19 pandemic and the health emergency that exists in the city of Paterson. No formal action will not be taken. You can go ahead.
Thank you very much, Madam Clerk. So, council members, we all know, and actually before I start, I really want to send my deepest sympathies, my condolences to our councilwoman, Ruby Cotton, for the loss of her beloved husband, a former councilman. There isn't really much words that I can say. I just wanted to just take a moment right now and I'll do it again tomorrow in our workshop meeting. But I just felt that it was needed to be said right now. That I send my deepest condolences to her. With that said, we know that we have a situation that is a global, international situation, and that's the COVID-19 pandemic. And I want to start this by first and foremost saying that this meeting is not to, in any shape or form, to attack anyone. This meeting is specifically for the city of Paterson and for its residents to get answers. It is beyond me that when I look at the data that is being provided to us, that there are discrepancies in that data. It is beyond me that when we ask questions, we don't get answers to them. When the community there's an outpour of over 3,000 infected individuals in the city of Paterson, but yet the community is saying, what is being done? They're being told to go to a 211, to call 211, to go into the Paterson Plus and put in a complaint there that there's even a coronavirus or COVID section. And all of these things are being done, but yet issues are not being addressed. The community needs answers. For weeks, as Council President, I have been numbers. And I've been saying that there's something wrong with data. There's something wrong when we get numbers that are provided by the county, and they don't match the city of Paterson's numbers. So I want to start off by just asking certain questions, and I am going to request an investigation be done, and I want this investigation to be done with the county health officer, okay? And one of the things that I don't understand is we reported our first death in March 22nd. We lost a life in the city of Paterson to COVID. Throughout the weeks, there were several days, there were several other lives being lost. And then it came to a stand, it came to a hold. And for an entire week, for 7 days, we did not have one reported death. Why am I asking this? Because I can't believe that in the city, in the state, when you look at the state numbers that are being provided, and you have thousands of people being infected, you have hundreds of people dying. In the city of Paterson, it being the third largest city, and our numbers continuing to increase, that for an entire week, there was no numbers reported. And then in the 8th day of a number not being reported, then only one death was reported. So I see a lot of discrepancies. I see discrepancies that just on Friday, we had the numbers of infected we had in the city. The city reported on its dashboard 2,566. But yet the county's number for Paterson was 2,734. 3 days later today, the city reported in its dashboard that we only had 2,812 infected. But yet the county's number is 3,117. So I say to myself, how are these numbers, how are these numbers being compiled? I don't want the pointing fingers. I just want answers. I want to understand why is it that the county can provide and get information from what I was told they get the information from the state. So how is it that the numbers that the city is providing are 300 less than what the county is getting from the state? So that question is going to be addressed obviously to our health officer. And we're convening this meeting today also because we are mandated to have meetings and convene as the Board of Health. And I don't think we've ever done that. You know, to my knowledge, I've been here for 6 years and we've never done that. And so in a situation like this one, you know, we definitely need to have some answers. So I want to start off by asking, why aren't our numbers, okay? And I know that earlier today I had a conversation, I was part of a conference call with the mayor who said this is not about numbers, but I'm not mistaken, there was a chief innovation officer hired specifically to work with data and numbers because we wanted to do something with the numbers, correct? And that will be able to assist us in serving our population. So I want to ask Dr. Prasad where we are right now in terms of today's numbers, okay? And why the reporting is not matching that of the county and of the state.
Thank you very much, Paterson. Can you hear me loud and clear?
Yes, I can.
Okay, so I just need to explain, give some background explanation so you can understand, so all the council people and all those who are participating and also all those who are listening can understand the process. So, and then the answer will come very quickly from that. So, as with all communicable disease, the state of New Jersey has a surveillance system. Every public health in New Jersey is local, as we can see now. So the state's surveillance system allows us access to our cases. So we do not have access to other cases in other jurisdiction unless it was inputted by the states. And you can understand there can be mistakes. There can be a lot of mistakes because multiple people all over the state are inputting data into that system. You have multiple laboratories, multiple hospitals, different institutions are inputting data into this surveillance system. It's a statewide system. It has been there for all communicable disease, for every communicable disease. This is just, COVID-19 is just another communicable disease. So when COVID started, we started getting our numbers. I have someone who does, our team is divided up into people with different responsibilities. So
How many people? What's the number?
the number is, initially we have 25 on the strike team. Our numbers have grown since then because I implemented a support to the strike team. So we have one, if not the biggest and the most, if not the biggest, and if not the most, one of the biggest and one of the most prepared team in the state of New Jersey. And that is known at the state level, that is known at the county level, that is known at every level. We did that, and I'm going to get into some more details later, but I want to really get to answer your question. So everyone has access to the state data, and I want to use an analogy of what happens. So let's say the state, I'm going to use an analogy, it's very, very easy, and then we'll switch back. So the state, if the state is a factory of Gatorade, and they depend on the city to check the taste of Gatorade and give a feedback, and the state decides to send Paterson 1,000 cases of red fruit punch Gatorade on, let's say, today. They sent us that, right? My team is working on flushing out those 1,000 cases. And we're tasting that Gatorade to determine whether it's actually fruit punch or it's not fruit punch. So the county now, this is really how the county has access to the data that the state gives to us. So the state gives us that data, and the county can only say what data they received from the state. But when it comes to my team now, what we do is that we go into those cases one by one. So if we have 150 cases today, we go into those, because first of all, we filter it. And at the end of the day, what happens is we tell the county, not the county, so we tell the state, or we tell the state. Hold on, I'm finishing.
Wait, Dr. Prasad, I don't want this elongated.
This is not elongated.
You should be able to tell me, Dr. Prasad, that you get your information from the state. There has to be a central place where you get your numbers. Don't tell me that the county is getting the same.
Councilwoman, if you allow me to finish one sentence, then you cut me off as soon as I'm
You're getting them from the state, and how they don't match. You need to answer that question.
I'm about to answer that question.
How does those numbers match? Please tell me those numbers do not match.
Okay, so those numbers, when the county sends us those 1,000 cases of Gatorade, which is cases, we go, the local health department, not the county health department, goes through each one of those cases to make sure it is a case. So whilst the state thinks that there's 1,000 cases in the system, and the county also thinks the same way, we realize at the end of the day, hey, you know what? Of those 1,000 cases of Gatorade that come from the state to us, 950 cases are all red, 950 cases are fruit punch, and 25 cases are watermelon, and 25 cases are strawberry. So because of that, our numbers are, and the state will tell you this. The state will tell you very clearly that go with the numbers of your local health department because they are the one investigating those cases. So I can be able to tell you this. State, you sent me 1,000 cases of fruit punch red Gatorade fruit.
Dr. Prasad, can you do me a favor? Dr. Prasad,
yes.
Can you not patronize me? Please?
Patronize you? I'm giving you a language.
I want you to pause because I see that I have various council members that are asking for the floor, okay? So I want you to pause for a minute. Because, and I don't want you to do strawberries and watermelons and oranges. Speaking of Paterson, it's residents, and we need to know the people the correct number of who's infected, who is not, who's tested, who's positive, who has gotten well. We don't have none of those numbers. They're not accurate, Dr. Prasad. And I feel right now that you're taking something personal on something that, you know what, we should be addressing as a whole. But if I'm asking you these questions, it's because it is obvious that we don't have all the answers, okay? And I think that we believe that we need to give our city of Paterson and its residents the correct information. One second, Dr. Prasad, 1 second. Councilman Rivera, and then Councilman Velez.
Can I finish answering my question?
No, 1 second, Director, 1 second.
We'll go back to that, Director. Let me simplify it. I don't want to get into fruit punch and Gatorade and any of this stuff from Kool-Aid. How you determine how many deaths we have in the city of Paterson? Let me simplify it. Because that one, you're either dead or you're alive. You don't have to give an analogy or anything. How do you determine, how you arrive at the number of deaths related to COVID? A very simple question.
At this point in time, the only way we can get deaths at this point in time in the middle of a pandemic is when we get information that is given to us from the hospitals, or from when we realize that our cases, one of our cases that we'll follow is dead. So the state, whilst everyone else is inputting that data, We do not have a way to filter out deaths until the state actually does it. We do not have that capability.
So I have a follow-up question then. So you mentioned you get the information from the hospitals. So I'm sure you have direct communication with the surrounding hospitals, I'm assuming. And how often do you communicate with them? Do you communicate on a daily basis? How does the reporting take place? Is it a weekly, daily? How does it happen?
So the hospitals have infection control practitioners. The infection control practitioners, if someone tests at St. Joe's lab, they report the case and we get it. What has happened under normal circumstances, the hospital will call us and say, I haven't yet from whatever communicable disease, whatever the cause is. We got initial cases because we are following these cases also. So when a case dies, we know that we report that. The hospital, a few weeks ago, sent us a spreadsheet of data. And after I went through the data and cross-checked it with what we already had from our information, we realized that there were X amount of deaths. And that is what I reported to the administration. Now, since that time, the hospital has not sent me any more data. But we've had communication with them because they say, hey, we're backed up, some of our people are on quarantine, and we couldn't.
Hold on a second. Hold on a second. Councilman Flowers, wait a minute. Director, this morning we had a conference call with St. Joe's Hospital. Ken Morris, the Chief Executive Officer, Kevin Slavin, the mayor, yourself, and I. That is not, the information you're saying right now is not true. Because you were told there is a central place. There is a central place where all hospitals and everyone has to report a central place where they report all deaths. And that you can contact that individual and that the hospital does not have to give you the health office. They can directly report. They report directly to the state.
The state.
Okay.
Okay.
So for you to say, I don't even want to repeat what you said this morning because you know what, I'm going to let it be. But you're not giving once again, you're not giving accurate information.
I will repeat what I said if you won't go on. So put the burden on me to repeat it. So I'm giving very accurate information. The hospitals have to input. Hospitals have to input the deaths into the same surveillance system that I have access to. The hospitals are responsible for inputting cases that they did the testing on through their lab. They also have to input the deaths. So yes, they do have to. And the deaths, the difference though is that I do not have a way of accessing deaths. The state has that. And they give that every day. So what we do is that you have to understand that we are following Councilman Rivera. We follow cases. So when a case dies, we will input that into our system. Hey, a case died. But we do not have all the cases that die. And if I call the state today, they may have a number, but the state gives that data every day. So you can go by that number. I do not have access to that, but the number is given every day. When it comes to cases are different.
Okay, 1 second. Councilman River, can you finish? I know Councilman Velez and then Councilwoman Mims.
I'm going to finish by asking a question and making a statement. So Prasad,
Yes.
so what's the purpose of submitting information that is not up to date? If the source that have up to date information is the state, why not just simply use the information from the state to determine how many deaths we have associated with this pandemic? For example, my question now, I said I'll have a statement and a question. My question is, based on your numbers, how many deaths do we have in the city of Paterson in comparison to the state numbers? I want to hear.
I can only confirm the number of deaths at this point in time that we have,
How many do you have, Dr. Paul? How many do you have, Dr. Paul?
the state, we have a number in the low 60s. That is what I can confirm. But we're looking at the number right now.
So you're in the low 60s. Council President, it seems that you have been, based on your statement, and you have been on top of these numbers. I haven't followed the numbers as close because I haven't. But based on the numbers, how many do the state website say we have in Paterson?
The city website?
No. So just okay. So Councilman Rivera. So let me just say this because I started by saying that even in today's conference meeting, okay, that phone call, he said a different number. Just so you know, not the a different number based on the information that he received from the hospital.
Do you provide the number?
Yes.
I'm not going to throw the number out here because
so why are we discussing things?
One second. Councilman Rivera. I have been following and I've been asking the questions about the numbers because when I look at what the city's dashboard, what's being provided by our health officer, okay, the data seems not to match. Okay, when I saw that for an entire week, there were no reported deaths. That to me is saying you can't be backed up. There's no way. So I started asking questions and I said there are different variables. The variable of the number of people that die in the hospital. But if you get St. Joe's number, that's just one hospital. How about those that live in Paterson that die in Passaic, in St. Mary's, or in Shilton, or other? I'm sorry?
Okay, right now we're having discussions about the numbers being inaccurate.
Yeah.
We need to compare apples to apples. You can't say the city's numbers are inaccurate, but then you don't have nothing to compare them to.
Yes, you can, but Councilman, the reason why I don't want to go ahead and put a number, okay, is because the director received, okay, Dr. Prasad received the number from the hospital, just
number.
That's from the hospital.
Say that number.
It was a different number than what's reported in the city. He said that.
Can you provide a number just out of curiosity?
Okay, I will do it. So I'm being paraphrased, but I'm being paraphrased incorrectly. I'll make that point. This is what I'm saying. So over the weekend, we sent out emails to all the hospitals to update their numbers on death. But so we got responses from all the hospitals. They're saying that they're in the process of doing it into the surveillance system, right? We don't only go by the surveillance system that is controlled by the state. I have no access to that. So, I have really limited access to that. So,
Listen, guys.
So they're not
We cannot conduct a meeting. I don't mean any disrespect to anyone. When I ask a simple question, right? If you don't have all the numbers from all the hospitals, I ask a simple question.
Yes.
The president just stated that at least one hospital provided you with numbers.
Yes.
Yes.
Let me ask you a simple question. I didn't say give me all the numbers for all the hospitals combined. If St. Joe's provided you with numbers today, could you please share with us just St. Joe's number as of today? Could you please share the number of deaths? And it should be a number. It shouldn't be, please.
So St. Joe's sent us a spreadsheet. After we went through the spreadsheet, we saw there were 86 deaths that are. You see, there are 86 deaths that were reported. 86. Now what we're doing today is that we're cross-checking those deaths, so there's those deaths we don't know if those deaths were already reported. So we have to use the data that we have and cross-check it with St. Joe's to be sure these are unique deaths. So when I get the number, it will not be a duplicate death.
Can I ask you a question, Dr. Cole? So the 80, and I apologize, Councilwoman Mims. I know you've been waiting for a while.
And God bless as well.
Yes, a whole bunch of, but I just want to stop after I finish my question and I'll let you guys do what you need to do. But Dr. Cole, it doesn't serve any purpose now. And they're giving you, let's say, daily figures. But now you guys should now take the time and start, listen, they're dead. And it's a little insensitive the way I'm saying it, but the numbers, they're not going to change. If 86 died, now my question is, does that also take into account the people that die in their homes, or is that just the ones that die in the hospital?
Councilman, our surveillance system, you have to understand, I have very limited information. I give the county every day how many deaths we have. It does not reflect people who die in their home. It would never reflect that. We will not do that.
So, Dr. Paul, don't you see something wrong? If your number says 60 right now, and you're letting the people in the city know that there's 60 people that died, right? Let's just say 60 people from this pandemic. But St. Joseph alone, not Hackensack and the other hospitals, and not the people that died at home. But St. Joseph alone is telling you that there's 86 people that died. Don't you see a problem with providing incorrect information to the residents of Paterson?
No, I'm not providing incorrect information.
We have to clear that up. We have to clear that up. And I'm sorry for interjecting. But what Dr. Prasad is explaining is the local municipalities, and this is high, and forgive me, I've done.
Well, one second, Councilman Jackson, I know I need to be fair. Douglas and Councilwoman Mims have been waiting, okay, so.
This line, by going down this road, what we're doing, we're giving a false narrative to the public. We have to make sure that we're clear on who's responsible for what. So, I'll
Councilman Jackson, the false narrative is that we're provided wrong information. So that's the false narrative, we're not providing.
That is not true. That is absolutely not true. You have to let me explain this. Someone's going to have to explain. I'm going to do it the second time. So let me explain it very calmly so I can explain. So the numbers I got to.
Just 1 second. Oh my God, have mercy. Dr. Prasad, give me a second. Councilman Velez and then Councilwoman Mims.
Thank you, Councilman. Council President, thank you. Dr. Prasad, I just want you to please write down this question, and probably in a short answer, probably clarify whatever you want to say in a long sentence. Meanwhile, you was talking, I was writing my questions. So probably it will elaborate your statement without going back and forth or whatever. So I'm going to make these questions, and don't answer it right away. I'm going to give you the end of the whatever I asked to you, then you can bring it up. All right? First of all, let me commend you. Let me commend you for being here. All the councilmen, thank you, because I know Councilman Jackson was pushing for this meeting for the past 3 years, and we made it happen. But at the same time, there's a public out there that are concerned, they're worried, they want to see results, they want to see positive ideas, they want to see things moving forward. We have the chief here, fire, we have a lot of... Yes.
That's a question, go ahead.
And please, this is my question, Dr. Prasad. Okay? And I just wrote them all to elaborate it. First of all, who made the decision? Who made the decision in having the testing site county-wide? That's one question. Second, why we don't have a Paterson testing site for Paterson only?
Oh, you can see it.
Second, that's the second question. Okay?
Who's
Now,
talking?
I am talking. Yeah. So, how many individuals out of the 2,812 individuals that is reported, 2,812 that are reported, okay? How many are admitted in the hospital? How many are in breathalyzer, okay? How many are discharged? How many of them are home already with recoup or quarantine? Because we're talking about 2,800. Something had to be happening, and we need this information. Out of the 2,800 individual reported, 2,812, is the answer. How many people we have in the hospital from Paterson? How many people are in Bradford later? How many people was the charge? And how
Councilman,
many
you see that number that, Councilman Velez, you see that number you said that 2812? The county reported today that Patterson had 3,117.
Okay, so
County said that Patterson today had infected with the coronavirus 3,117.
correct. So okay, so let's make believe it's 5,000, Council President. Let's make believe it's 5,000. From the beginning that this is one patient was diagnosed in the hospital. And the first one was Dr. Bruin. And Dr. Bruin lived in Teaneck. They brought him to St. Joseph. That was the first patient that we know that got infected. Then a family got infected at second, third day. From that point on, there had been this amount of individual tested positive. How many of those are in the hospital? How many of those are discharged? How many of those have ventilators? How many of those have been recuperated from home? And let me tell you another thing, and the numbers too, Dr. Pizat, I know that, I believe, and this is another question, are you a health officer for any other municipality around Paterson? That's another question. The last question is, do you know for a fact that the individuals that are being dying home and resident assault are patient that was in the hospital or they was in the center, senior center, and because they didn't have the personnel, they sent them home, okay? Are you affirming that this are patient that passed away because they are COVID-19 patient, or they just die because they have another illness that was not taken care in the hospital or in those centers, and they blaming the COVID-19. So all those questions, I really answered. And then we could know where we stand, because from the beginning, from March 14 or March 16, okay? From the beginning, we're already a month and 3 days, something like that, right? I believe. So you telling me all the confirmed cases, but I have conversation with individuals that got dismissed out of the discharge from the hospital, that got, they already sent them to work.
Okay. So Councilman Velez,
Council President, it's the director, Jerry Spezial. I just want to point something out. And the fire chief could probably point this out, or the police chief could point this out even, the fire chief even better. But what happens is, when we get an ambulance call and we run to, say, 5 DOAs on a particular day.
Dead on arrival, Councilman, DOA.
I know.
Yeah, dead on arrival. And what happens is, and Fire Chief McDermott can speak about this, what happens is sometimes our police officers will go in with the firefighters, they'll do their investigation, see that it's a natural cause type of death. Yes, they have every indication that it was COVID related to us. We notify Dr. Paul. But what happens is a lot of times the doctors will sign off on it and as a natural cause death, so we're not investigating a homicide. And what ends up happening is they'll take that person and a funeral parlor will come and get that individual, or we will take them to the hospital. The fire department would handle it, but we don't know. We think they're COVID. We believe in our mind they're COVID, and please correct me, Chief McDermott, if I'm wrong. But we don't know it factually.
But Director Spezial,
Yeah.
wasn't there a mandate from the Attorney General's office that mandated that the health officer provide the police department the list of people that tested positive? Therefore, when you're sending your men and women, your fire department, your EMTs, that people know that that is an area that you're coming to. So I'm not understanding what you mean when you say we don't know.
Yes, no. We know the ones that are in our system, a person under investigation. Yes, we get that. The officers get that. The firefighters know a person under investigation. But it's that person we may go to that's a DOA that is not under investigation, didn't
Okay,
test
so,
positive.
so Director,
So
we already
do have
know.
them as well.
Right, so we
So I just
already
wanted to
know,
make that
Council
clear.
Member, Director, give me a second. So
Yeah.
we already know
Sure.
that there are various variables here and that there's major
Sure.
issues. Councilman Bellis, you go and you asked a lot of questions. The reality here is this.
Hold on, before you,
That comes from the local, one second, the local hospital.
you said, no, Council,
Wait, 1 second, Councilman, please, 1 second, 1 second. So we understand, there's a lot of questions, you're asking a lot of questions, and, Dr. Prasad, I'm sure, is writing them all down so he can address them. But we all see here as council members that there's an issue here, that we're not getting accurate information, okay?
Dr.
That we're not
Prasad,
getting
please answer
accurate
questions.
information.
for that
There's
one.
not accurate information, and it is a reality, all right? So what we need to do is come here and say, what are we doing moving forward? I'm gonna let Councilwoman Mims, because I know that she's been waiting patiently, okay? And we're gonna get back, because Councilman, you asked a lot of questions, but I want everyone to put their questions, so then that way, he can then address us, because if not, we're not gonna be over this meeting today.
No problem, okay, and come back here.
Understanding what it is that we're gonna be communicating to the community. Because right now, we are not sounding the alarms strong enough that people are still out there hanging out. I get it, I see the teacups, I see this, I see that, but we still have people out here not listening. And I think we did a poor job in sounding the alarms when I addressed this with the health officer back in January and February, even before the pandemic started. So I'm not even gonna touch that right now. So Councilwoman Mims, if you can please,
Thank you.
take the floor.
Thank you, Council President. So I just have a few questions, and I don't see Dr. Prasad. Okay, I see him. So I know you said that we're dealing with the data from the surveillance system from the state. So I assume that that's the central repository for data that we're all utilizing. So my first question is it real-time data or is it SKU data, and what is the variance of SKU? That's the first question. The other question is, you have 25 people on the strike team and you're saying it's growing. I would love to get a list of who's on the strike team because we've never seen it. I know we talk about the strike team, but I'm not really sure who's on the strike team. Are there doctors on there? Are there people from the medical field on there? One of the concerns for me is we have a Health and Human Service Committee, and I'm not sure, and I doubt if any one of us were on that strike team, and I think there should be someone from the council a part of the strike team. And then I know with St. Joseph, Valley Hospital, so many different hospitals, when we get the report, I think Director Jerry kind of went into it as it relates to whether it is COVID, whether it's not COVID, and sometimes I'm not sure, are they able to fully detect it if it's COVID without doing an official autopsy? And that's why I'm asking with the strike team, who's on that team? Because wherever this data is coming from, we have to make sure when someone, when they die in the hospitals or whatever, sometimes they're not really able to truly detect what it is outside of an autopsy. So my question is, with the variance of numbers, the 60 plus 62, now I'm hearing the number at 86, like what is the variance of the SKU? Why are we getting different numbers? I know we all on here, all the council members have stated it. I've asked as council president, we all have talked about the mapping data. I've been asking, at first it was said that we could not get it, the Attorney General would not give it to us, and there has to be a level of truth to that, because every day we're on social media, and Passaic is doing it, Newark is doing it, Jersey City, they're providing data, maps. They have maps of every area of their community where you can see like the little red dots, and they're flagging which particular communities are infected, the ethnicity, the age bracket. I think the more data that's provided, the better we have with communicating the message for our residents to stay home, to practice social distancing. But it's very difficult to do that when we don't have all the data. We're getting numbers one day, then it goes almost a week where we don't see any type of data, right? We don't see anything. and then we go on social media, and then I was told there's a Passaic County website, and one day I was told, well, we give this data is available. So I'm like, well, we don't get it in Paterson. I think they were a little shocked that we're not getting this data. So I know it's frustrating for you, but it's frustrating for us as council people, council men and women, because we're actually on the front line, and people are talking to us every day. We don't have a test site locally. They have to go all the way up to William Paterson, which we're grateful. The county chose to open it, but we have so many available. Like, we could have used Hinchcliffe Stadium. We could have did different sites. We could have went to the senior buildings, so many different places, and we have a number, but that number is not true and factual because we don't have it where it's accessible to all. And what happens is when we don't know what's happening, it causes, to me, that's more of an alarm. Today, I heard it reported in the governor's press conference that the numbers are going down in New Jersey. So are they going down? Are they not going down? Like, we need to get if we can't get real-time data, because I think that's what Council President is talking about, real-time data, tell us, what is the variance of skew? Is it 12%? Is it 8%? Is it 10%? Is it because if they're where they're in their homes, their dead on arrival is not counted in the numbers? Just tell us. I mean, internally tell us. Send an email to us. Say this is what's happening so we can move forward. Council President, I'm not going to stay on tonight. As you know, I have death in my family. My uncle passed away. So I'm not going to stay on tonight, but I wanted to come on because I didn't want it to be that there was a special meeting going and I wasn't a part of it. But I really wish Dr. Prasad and the administration that this information is provided sooner than later, because we need to know this. We really need to know. So, and I want to see as well, I think Councilman Velez said it, I want to see who's being discharged. I want to see who's recovering. I don't want to just see the data on who's dying and how many cases reported. I want to see the great news stories of what's happening, because we need to know that people are living from corona. Like, everybody's not dying. Everybody's not. We do have deaths that have happened, and our condolences. My heart goes out to many of the families, and it's heart-wrenching because you can't go visit them in the hospital. They have to take their last breath without you. Only 10 or less can go to the hospital, and now where the cemetery, you can't even go. So it's very heart-wrenching, but I want us to get some level of data and information so that we can communicate properly with some data and some level of intelligence to the community. I don't want to be here all night. I'm not going to be here all night, actually, but I wanted to drive these points in because I think it's really valid to ensure that we, as the legislative body of our city, that we're giving out information to the community that where they can feel they can trust the information we're providing, and they're not looking at us crazy because you're not giving us what we need. So I think it's important. There's many valid points through this council, and I'm sure more will come up. But I think what you're saying, I pray that you're taking notice of it and taking notes and providing an update. Strike team data, we should have that tonight. Who's on the strike team? What day did they get on the strike team? How long have they been up there? Who are you said because it's growing, so who are you considering to grow? And then the consideration for members of the Health and Human Services Committee. We have a committee of 4 council members, and there should have been at least 2 of us, or it could have been all 4 because we have 5, but you should have at least had members from the Health and Human Services Committee from the council on the strike team. Yeah. Those are just some things I'm putting out there. I'm not sure I picked them or who selected them. I know Councilman Jackson has been fighting for almost 2 years. I've seen it in the paper. I've heard him at the council meetings for this to be at Health and Human Services. We are the body that, we're the ones that communicate, and I'm glad we're doing that tonight. But we have to make sure that we do things in a more timely fashion so that we can move the city forward and we can bring Corona to rest.
May I respond to you?
Thank you very much, Councilwoman.
Councilwoman Mims, may I respond to you?
Yes.
Okay, our strike team is made up of communicable disease investigators that are trained to do this job. And some of them have been doing it for many, many years. and others are being trained. We trained 25 disease investigators last year. So we have, and after that, we expanded it a little more because we had others in our clinic working that were also trained to do this. So we brought them on board. So we have, those are communicable disease investigators. They are not members of the city council, or they're not members of the administration necessarily, from the office of the mayor or from some other office. These are people who are trained and who have the required training and required confidentiality agreement to get into the surveillance system, the state's surveillance system. So there's training that's involved in this. We got training from Louisiana State University. We also got training from the state of New Jersey. And I also do training. And some of our senior members of the strike team do training. Today we have training. So that is to give you the composition of the strike team. The strike team is an investigator, is an investigative team. They're trained to do epidemiological investigation. So that will clear that way out. With regards to the data is not real-time data. The data lags. If someone died at home, we would not have that data. We would not know about that until sometime later. If someone that goes to the hospital, we would not have that data until sometime later. I'll give you an example. Right now, for the past few weeks, we've been calling cases that were entered 4 weeks after they were hospitalized. So there's a big lag in the data. I have no control over that. This data is not real time, and that's why the state will tell you the data for cases is the most accurate data, or the data that's most close to accurate is what I give in terms of cases. I am not responsible for deaths because that is not that is not what we get from the system. One day the system is going to give that, but right now everybody's lagging in their data for death. So I got emails and they say, well, we're putting it into the surveillance system. But know that I do not have a way of accessing the number of deaths. What I give for the city is if we're investigating a case and we found out that that person died during the process, or we know they were hospitalized, and we have that case, when they go to the hospital, we will follow them, and then we will know if that person died or not. But know that this system is not set up for this, and we do not have access to a lot of the information you're all asking. That's not my fault. That I have no control over the state.
Council President.
Council President.
And just to add, Councilman Allen, I'm just gonna be done. With the strike team, when I asked for the names, now with what you just stated, I don't just want the names, I wanna know the roles and responsibilities. What is the strike team, what are they charged to do?
Yes.
Who are they? Because they're not just communicable investigators. There are more people on that team than that. I wanna know everyone on the team, what are they charged to do? What type of training they received, and what training is needed to ensure that we have a fully functional team. Like we have a strike team, we don't know who they are and what they're doing, and we need to know that. We need to know who we can call. If we have a concern, who can we call outside of or in the strike team, or we just need to know all that data. We don't have it. We've been going through this for months at this point. We need to have this information. I know that you should have it already, so it should not be hard for that to be given out to the entire council.
We have it at all the members of
1 second, Councilwoman Mims, thank you very much for, Councilwoman Mims, thank you for bringing forward information about Dr.
Jesus.
I'm trying.
So let me just, I want to thank you, Councilwoman Mims, because you brought something to light that I have been asking about the strike team. I've even asked the mayor. I even said, can I just sit and be quiet, to be part of that, because those roles are important. I can't understand how is it that the other cities, the other municipalities, Passaic and others, they get their information in a quicker response, but our team, that what I'm hearing is that's like 35 people, and yet we're not getting the information in what I consider a timely fashion. All right, so I want to thank you, for making and putting those points forward. I know that Councilman Jackson has been waiting, and Councilman Councilman Abdelaziz, you just got on and he's been waiting, you know.
I've been on like 30 minutes. I heard
Okay.
Councilman first side. But go ahead, you go.
Okay, Councilman,
I haven't spoken yet, Councilman.
No, I heard you speak before. I guess there's somebody else that.
okay, so, listen, I think everyone here is gonna bring great points, all right? But I wanna leave this meeting just knowing this. What is it that we're going to do from here on in? Because I'm gonna give a directive of stuff that I want done and investigation done. And I have my points here. So we can elongate this and be here for hours, all right? So Councilman, Jackson. Councilman Jackson.
Thank you, Council President. First and foremost, before I even begin, very quickly, Dr. Passard, how many people in your office has been infected with COVID? Dr. Passard.
Someone unmute him.
He's on mute.
You're on mute, Dr.
And
Prasad.
we also take it serious, and he took his off.
Okay. Yes, Councilman Jackson.
Dr. Passard, how many members in your office have been infected with COVID?
As of yesterday, I got more than one person got infected with COVID as of yesterday. That's prior to yesterday, no one was infected, but yesterday, someone that worked for us and worked part-time somewhere else got infected. That's all the picture I have at this time. And that's the answer, one person.
So the point that I'm making, Council President, is very important that we understand the roles and understand, what our responsibility is. When we talk about the lack of knowledge and lack of information, is because this board has not sat as a board of health. Dr. Prasad, who is the health officer, has yet to come before the council in the presence of the board of health, acting as the board asking specific health-related questions. Human services have nothing to do with the health department. That's an administrative function, and the council has to take its responsibility. And if we're going to be asking these kinds of questions and expecting those answers. Now, we have to be clear with Dr. Prasad, and I know it may not have been a very enlightening example. What he is saying is that, and I found most of this information from the years of doing the investigation, because it wasn't Councilman Jackson. I'm not the person who said that we're supposed to be sitting as a board of health. State health director issued a notice directing the city of Paterson must convene as a board of health to address these issues. And it is because Dr. Prasad's office is accountable for the accurate information, is what he's saying to you. The county has one nurse who works for them, when Dr. Prasad has 12 to 15. So the city of Paterson takes in numbers from various places. They may get a number from the hospital. They may get a duplicate number from the county. A duplicate number that's already been posted on the state. They're responsible for going out and doing the investigation to make sure that the information that's provided to the community is accurate. And that's what he's saying. When he talks about the various flavors, and I know it's a very bad example, but when the data is absorbed, they have to go through it, they have to scrub it, and they have to re-disseminate it, making sure that the people, to what Director Spezial was saying, if it is presumed that the person has died from the disease, but later on found out that it was not, they cannot falsely report this information. They have an obligation to go and do the investigation and find out where these numbers are accurate. The hospital does not. The hospital gets information that they have from their hospital. They don't get information from the families. They don't get information from other hospitals. They don't get information that might be sent over from last night. The fire department was gracious enough to take my uncle to Valley. Valley Hospital has a responsibility to report that. They then put that information into the state's database. It is then re-reported back. If by some chance this same person had been reported to the health clinic or St. Joe's Hospital, it will be duplicate data. So the city of Paterson is tasked with going out and scrubbing the data before it puts the information out. And that's part of the reason why it's very important for us to understand who are these individuals so that we can put the things in place. Now,
Councilman, can you just, wait, just in the middle of what you just said, Councilman, wait a second. Because you know what, you just used an example of the hospital. If the hospital is addressing and giving you a number, a report of coronavirus deaths, and they give you a number, not the total, Councilman, and then your city is reporting another number, that's a problem. You do not see it as a problem.
Council President, if my mother's a director of nursing at another institution in the city, if she reports it and the hospital reports it, that's a double reporting. If he takes both numbers from both agencies and he reports it and he puts it back in the system without doing the investigation, it is a mishap on his part. Yes, the hospital can report the numbers, and not to say that their numbers are not accurate, but he still has to do his due diligence and report and do the investigative process for those numbers. And that's the point that I'm trying to make. Now, okay. The other thing, Council President, I'm sorry, please, very quickly. The other thing that is very alarming and disturbing to me, because this council has not sat as a Board of Health, because this council has not convened and made decisions relative to the safety of the public. What happened and what I can't tell you how disappointed I am, because I read an article today that states clearly that the county made a decision to put something in place. Now, Paterson, which is the most densely populated community in the state of New Jersey, in the county, we have a multitude of seniors buildings where people are lacking transportation. We also have a greater number of people who lack the ability to have access to public care. Why was the county allowed to override our health director and put the testing center over at the college in Wayne, as opposed to doing it in Paterson? Is a direct example of why we're responsible to sit as this board. Those decisions should not have been made political empowered decisions. And why was the health director, and furthermore, from what I got from the article, it states that the mayor was a part of helping make that decision to allow the county to put that testing center up in Wayne. And that right there is a huge disservice to the public of Paterson. That's the reason why this council is tasked to sit as a board, so collectively, based on the directives of our health officer, we can make decisions that's best for our citizens. One of the things that differentiate Paterson from other municipalities, Passaic, they don't have a health officer. Clifton, they don't have an health officer. They have a regionalized officer. They have one person oversees those multiple municipalities. Paterson, because we have so many issues, we have a health officer who is dedicated just to the concerns of the city of Paterson, and for that decision to have been politicized is an embarrassment.
Okay,
and I would like for Dr. Paterson, I want you to answer that, because how is it possible, if from what I'm gathering from the article states clearly that there was preparation done to open something in Paterson. Who made the decision to allow the county to override it? And what happened to the dollars?
Councilman, we don't have the money, Councilman.
May I answer?
I'm sorry?
1 second, but Councilman, just because you're touching on something, the city of Paterson did not and does not have the capacity like William Paterson. So the monies, we didn't have the money.
We have more capacity than the county. The city of Paterson has more capacity than the county. They have one nurse. They have one nurse.
Councilman Abdullah.
Yes, I have.
Thank you, Council President. First, before I address
this body. I want to commend the council president for putting this together. This meeting is long overdue. I know since day one with this COVID crisis, you've been really making the noise and making sure that the city's prepared. So Council President, I commend you for putting this together and your passion to making sure that our residents get the service that they need with this pandemic. So thank you, Council President. To the director and to the BA. We can look at data to the council. We can look at data all day long, right? That's what data is there for. There's people that just look at numbers and look at data. The most important question that should come out when you look at data is how do we improve and how do we make, our residents safe? And I think today, looking at the data, we could really talk about, oh, you put this number late, or we put that number late, or this came in late, or that came in late. At the end of the day, people are dying. No one cares when the numbers come in or when don't they come in. What I do see from the data, that our community is struggling with this virus. Day in and day out, it is a death sentence to the residents of our city. The density, the demographics, the underlying issues. The African American community is getting hammered by this virus. I watched that CNN series on CNN Color of COVID, and sitting here as a council, we need to do something. This administration needs to do something. This council needs to do something. So I think collectively, we all have a passion to make sure that we want to deliver something to our residents. But I want to urge this council that let's let the experts do their job and let us give the tools that's needed to improve their job. We do have a power as a council for the fiduciary responsibility. And that's where I'm sure our Councilman Finance Chair, Councilman Rivera, will look at the numbers and find numbers where they're at. If you look at the experts and you see that what they tell you is there has to be a ramping of testing going on. We have to see more testing. We could talk about, oh, we yielded to William Paterson, or we didn't. You know what? Let's open up a test site. Let's look at what we have to do. Let's get creative. With all due respect, William Paterson is close to the north side. They could go there and get tested. We should have something else in the city of Paterson. As long as where we put it at, we need to ramp up testing. Director, that's my request to you. This is the Board of Health, and we're convening as a Board of Health. You put a plan. Show us your plan to ramp up testing and the cost it takes. And that's where, as a council, we see if we could meet those demands, and the administration, and we are the fiduciary responsibility. There is a crisis. We may have to exceed what we're spending on because this is an emergency.
May I explain?
No, sir, I'm not done yet. I want to, then you can explain. There is no explanation. It's a request. You're the health, I'm asking you a request on what your plan is to ramp up testing. If you were to get 1,000 test kits, what's the cost to do 1,000 test kits on Broadway or at the firehouse? How much would it cost the city so this council can make their decision if they want to move money around on the budget and look at where it's at or spend what we want to spend? Because we could talk a good game. We could talk about we need this test site, that test site, but everything costs money. And I'm going to go one step further. I have a group of medical doctors and medical students that will test for free. You bring them the test kits, they'll work on Saturday and Sunday, and they'll do the testing for free. They're doing it right now, William Paterson. They call me every weekend and say, hey, whenever you're ready, we want to do it in Paterson. Unfortunately, I don't have the test kits laying in my basement. That's where the city needs to say, we'll purchase the test kits, let's open it up. We'll open it up on Broadway, open it up on South Paterson. Wherever the administration and the health director deem it's necessary and it's there, I have volunteers on the record, medical doctors that are ready to test for free. They just need the test kits. They have told me that. Get us the test kits. I've called the county myself asking, give us the test kits, we'll test in Paterson. Unfortunately, they don't have enough. That's where I would hope that the health director and administration, the health director, give us your plan. How do we ramp up testing? Let us know on the second fold, the strike team. The tracing the person is the most important thing once you get the diagnosis. That's what I've read. That's what I've heard. I'm not asking you to be an investigator. I'm not asking to add us on there to go around and investigate. That's not our job. You have professionals to do that. 25 members for community tracing may not be enough. May not be enough. You may have thought it was good, but you need to reevaluate. Do we need more? Do we have to get more help? Do we have to bring in help from the state? Do we need to put a request? I don't know. I'm not on the ground. Is 25 members enough? Because what I'm seeing is the spread is pretty significant compared to what we're seeing. So, the data, I agree with my council colleagues. I'm sure there's a lag. I just looked at Governor Murphy's page. In the Passaic County, he says there's 263 deaths in the entire county. And that was an hour ago from the state, which I think is more than that. We're saying there's more.
Councilman, I agree with you with this testing. That is a absolute solution to help us. And I know the fire chief is well aware of the way to do it because he was the one that led the charge on that. So I won't take his thunder on that. But believe me, that is the way.
I have enough I can do.
Could we get a price real quick, Council President? If we can just get a price, and we really need to see how we ramp up testing through the business administrator also. I'm talking about, let's get 1,000 kits and tell us what's the cost, and even, Kathleen, if I may be wrong, and Council Rivera, I know we suspended and put a hold on CBDG funds, right? Maybe we can take those funds, allocate it to a nonprofit health center that could use that money for testing for Paterson residents.
May I respond quickly to the strike team part, Councilman? May I respond to the strike team part? Yeah, I'm good. I'm done, Council President.
Dr. Paterson.
Yes. Yes, so So Councilman, our strike team works based on the cases we get through our surveillance system. That's the only way to work. You have a local health department is arm of the state health department. So every case that is a communicable disease is a reportable disease. Whether it's hepatitis A, whether it's syphilis, COVID is a reportable disease. So every time a lab does a test, the lab has the responsibility of reporting that positive case into the CIDRS. Why? Because the lab is the first point of having that information. So the lab reports that into the surveillance system, and the hospitals also does some testing, and they also are charged with reporting. So once they report that into the surveillance system, then it comes to us. At this point in time, we are not overwhelmed by our numbers. We are great. We've never been at any point in time in this outbreak. We have had numbers, a lot of cases to deal with. But and then again, I have to applaud my team because every day we distribute every case that we have, and they're investigated, they're followed, whatever we have to do, we only abide by the state health department guidelines. That is what we can do. That's what we're tasked to do. So, right, I can assure you 100% that whatever case we get, our response time is better than any other, if not equal, better than any other health department.
So then why don't we have numbers, Dr. Prasad, so then why don't we have numbers of how many people have been tested negative and how many people have got what?
Negative, Councilwoman, okay, let me answer your question. The surveillance system does not provide negative tests, it only gives cases. If there's and that's a good question, because if there's a negative test here, then what happens? We have to remove that because it's not a case anymore.
Okay, but they positive and then they got well. Where's the data for that? How many people that tested positive have gotten well?
We do not know that because people, if someone goes to the hospital and they're discharged, we may not even know about that case because it may not be in the surveillance system because it was not inputted. I am only responsible for getting cases from the state's surveillance system. I'm not tasked to go to hospitals. I'm Dr. Prasad. So I just want to understand that.
Thank you.
You know what? One second, Councilman. So I know that, Councilman Abdelaziz, I know you mentioned more test types, right?
Can you just get Catholic to see if the question with the millions of dollars in CPDG funds, if that's usable for mass testing?
Wait one second, because you mentioned something about testing sites, and I'm just saying, if we can't get accurate numbers now and we continue to add more testing sites, what are we doing with the information?
Council President, the testing sites is not about, it's about what you do with the data. The testing sites is able to tell someone.
He just came out that he's not.
No, but once you get a positive. Yeah, but once you get a positive, right now, if Jimmy Smith gets access to a test site, he goes, gets tested, and he's positive, you isolate that person from spreading it to 6 other people. Without knowing, no one knows who's now. It's hard, people say it's hard to get to William Paterson. What I'm saying is, every governor, every inner city, every major city has said we need to ramp up testing. Paterson has to be ramping up testing. And one thing that I want to ask our director, who will be responsible for that, give us the plan of what it will cost for us to get it. And 2, the money, I know we say we have no money, I don't know if we can or cannot. We do have CBDG funds that are not being used. Could we direct that to health centers that could use that for testing, or could use that for testing the city itself? I don't know. I see councilors say no.
Council President.
You got Dr. Gardner. Health center.
I know, Councilman. Shaheen Khalid has been waiting. He's been waiting.
Can you answer that real quick?
Thank you. I'm just going to follow up on Councilman for the 6th word.
Councilman Khalid.
Yeah, I'm just going to follow up with Councilman Abdelaziz. Dr. Prasad, has any local doctors or clinic got in touch with you, with the health department to help with this pandemic and do some testing or anything?
Councilman Khalid, that's a good question. Councilman Khalid, this a local health department or any health department in the state of New Jersey is an arm of the state health department. So, Councilman Khalid, before we can do a test, before the health department can do a test, it must be sanctioned. There must be a rationale that the state has to approve. That's number one. And it cannot be a test that any physician wants to apply. That is good for a physician's office. But if the state of New Jersey sanctions a test for the city of Paterson, it cannot be any doctor want to come and do a test. This weekend, for example, I must tell you, the FDA came out and said there are many antibodies tests that's being circulated out there, and they caution people that they're not validated, and they're being done in doctors' offices, and they're not validated. So we are an agency that is an arm of the state local health department. We do not make certain decisions. My role as the health officer is streamlined as to what I can do and what I cannot do. I cannot violate the guidelines of the state health department because
we are not asking you to do that.
I'm just explaining the process. Yes. So that is how it is. I have to go by State of New Jersey Department of Health guidelines. The country, when they did their testing site, they went by State of New Jersey Department of Health guidelines. When I wanted to do a testing site in Paterson, I called the State Health Department. They said, well, yes, you can go ahead and do it. The only thing is that they did not say I cannot do the site. I cannot do it. But obviously, if I'm going to do it, I have to abide by State Department of Health guidelines. So that's
Did you have the money to do it, Dr. Prasad? Did you have the money to do it?
We did not reach that point. I was implementing, the mayor, I want to explain something. The mayor, and please give me a minute to explain this without interrupting. I've been interrupted all the time. So let me explain this. Our mayor we were on the front line of this when it comes to testing. And I must give him credit for this because we sat and we put in place mechanism implementation because we were capable of doing that at the city health department. We were capable of doing that. That was the plan. We were not capable of doing the entire county, but we were capable of doing the city, the residents of the city, following the guidelines of the state of New Jersey. And we did that. I got the price for the testing. I worked it out because I did my internally here. We know I'm going to do it because we prepped for this. See, these are some of the questions that should be asked. We had preparations for this to apply to administer mass vaccination. We know how to do this. However, then our mayor, and I sat side by side with him, and he was, before, and as much as I know, we were on this before the county. We were. And the mayor was there, the mayor provided information, and I can tell you, the mayor reached out to Congressman Pascal's office, and Congressman Pascal's office provided contact at BioReference. The mayor gave that to me. We were in contact with an agency that were going to supply us with nurses, so that my nurses can continue doing the working on the strike team, and we want nurses to come and do this. So this was in the phase. Let me finish, and I'm going to answer all the questions. So our mayor was in the forefront and leading from the front in this. Now I'm not a politician, and I can say this. We had it at a point where now we're going to work out implementation. I had price quotes from BioReference Lab, and BioReference Lab told me that they can give me X amount of test kits in a day, and then 2 hours after they said, okay, we cannot give you 1,000 test kits, but we can give you 500, and we're getting more test kits. I said, okay. So they wanted me to make a commitment how many test kits I need. It's a sale thing. I said, at this point in time, I have to get that. I do not make these decisions on my own, so I have to discuss this with my administration. And so our mayor was in the front of this long before anyone else. What is that?
What was the quote for the testing?
The testing with the kit was coming, if my memory serves me well, was around $55. I worked in conjunction with our mayor. We did this. We were in contact.
This is not about the mayor right now. Madam BA, answer.
In time, this was very
about the number of tests and bifurcating the sites, both for the testing supplies as well as the medical professionals who they're trying to get as, whether it was the county or other counties throughout the state. The State Department of Health was really focused on the county level and wanted to get the county ones launched. So think about it. At this point, this was the only one that was up and live was the Bergen County one. The Monmouth County one was going to be launching, and the Passaic County one was going to be, I think, third on the list. And we were already putting in all this prep work to have one in Paterson, because we agree with you. From the start, we knew there was going to be concerns about people who didn't have cars, people who weren't going to be able, who were nervous about going somewhere else, who just wanted something in Paterson. But the question at that moment in time was really about the test kits. Was there going to be enough to be doing these projects?
You're saying the state mandated that it was done the way it's done?
I'm saying that the conversation continued at the county level, the county and the state were saying we need to focus on getting the county one up and launched so that it could serve everybody.
I made the decision to have it outside of Paterson.
No, it's not a question of outside of Paterson. The question was the state county one was always being launched. The question was, were there going to be enough test kits to be able to do a Passaic County one and a separate Paterson one? And at that time, there wasn't any clarity on that from any leadership. And that's talking about the test kits from the bioreference labs.
Okay, Councilwoman Mims.
I'm not going to say Council President, but.
Okay, Councilman Khalid. He's not done.
Okay, about how many city employees have been tested positive, Dr. Prasad? Yeah, you.
Council President, we have too many people on this call.
Dr. Prasad.
Yes. So Chief McDermott organized his testing, and then I think police came involved.
Dr. Prasad, just answer the question. Dr. Prasad, just answer the question for Councilman Khalid.
How many city employees have been infected by this virus?
I would not know that, Councilman Khalid, because I'm giving you an example. Let's say police officer. If they live in another jurisdiction, I would not know that, Councilman Khalid, because this is by jurisdiction only. So if we have people as a police or a fire and they live, let's say, in Wayne, I do not have access to that data. This data is very local to Paterson that I have access to. So how do you have to report their positive?
Yes. I can look up what I can get that information about city employees, because we do ask the different supervisors and department heads to report that into personnel. So, but I don't have that number in front of me.
Is that a legal mandate that the employee has to advise their employer? I know my employee, if I have to call my employee, I might call my employer and notify them.
Yes.
Because there's protection for the employees. Is that legal fair? They have to tell us.
Yes.
Right?
They have to tell us in part because the specific type of leave is covered if you do have COVID. So we need to kind of be able to track that and include that as part of their personnel file and their paycheck and all of that.
Okay, Councilwoman.
Yeah, so two things. First, I just want to, as a point of reference, I know Councilman Al said he doesn't want to sit on the strike team. I'm not saying, I'm asking first who's on there and what they're doing. I'm not saying we should sit there because they're investigating. We don't know what they're doing because we don't know who's on there. So I just want to be clarity. I want to know who's on there and what is their role to serve the community. I'm going to know that.
Yes, jump in and answer that question.
Piggyback off of Councilman Abdelaziz, his point for finance. Can they identify, we know we have a population of almost 150,000, 146,199. But can we do a See, the problem is because we don't have accurate data, so we can identify from 0 to 100, what percentage are we seeing the deaths? Is it in the seniors, whatever, middle class, young, whatever? We have skewed numbers, but my ask is, when it comes to Madam VA with finance, can we identify the numbers of seniors, and perhaps we know we eventually want to do it across the city, but I think we need to actually look at our seniors in the sites. They're already in buildings, and I'm not sure if it crosses any laws or guidelines. That's for the health department and our VA to find out. But we definitely need to, because if our seniors are they're susceptible to this, as well as other people are, but if they're the higher number, which internally you guys should be able to figure that out, what is the highest number and what is the highest demographic that's being impacted? And we have to identify that data so that we can come up with an action plan, whether it's in phases, phase 1, 2, 3, whatever that looks like, but we have to strategically phase a plan out to start testing. We gotta identify the cost, we gotta identify how many test kits we have or how many do we need. If the numbers are going down, like the governor said today, I see some locations are opening up. Maybe they're not in New Jersey, but they're opening up in other areas. Maybe we can get those test kits, I'm not sure. We probably have to be creative with the process, but our seniors are not able to go in or out. And we have to do something across the city, but especially for our senior citizens. We have to do something. We have to do something like yesterday.
Yeah, and that is Councilwoman to that. So Councilwoman, to that note, that was actually a conversation I had last week, and I spoke to the Chief of Staff, to Della, and one of the things that I mentioned to her was, if the approved Rutgers University saliva test, if we were able to bring those types of tests to the seniors, because you're right, seniors, they don't have cars, they're afraid to leave their houses, they're the most vulnerable. When you look at the numbers, right, they're the most vulnerable. So that is definitely something that should be addressed, that we, just like, Wahida Mohammed, she called her last week, and she asked that, about what are we doing for seniors. We should do something in terms of us going to all the senior sites and providing, maybe not the way they're doing it, the test, the way they're doing it, like at Rutgers, William Paterson, or like the chief of fire did, but bringing the Rutgers University approved by FDA saliva test to our students. That's something that definitely, I think, we need to look into.
And then one time,
can I respond to her real quick on that saliva test?
Hi.
No, go ahead, Councilwoman Mims, I can wait.
Okay, and just a final, you may miss my point. Okay, you can say it and then maybe you'll come back to me.
Just be mindful with the Rutgers test. It has been FDA approved. However, they have not received I guess it's like the barcode number to actually be able to sell the test. That's what they're waiting on. That was the last report that I got on that. But do know that in the early stages of this, most of the tests were only by symptomatic status from the beginning. You had to have symptoms and you had to have a doctor's note for the test. So for example, if you wanted to just go take the test at any of those testing sites, they're not allowing the average person to walk up and say, hey, I want to be tested. You did have to have a doctor's note and you had to show that you had some symptoms. So I don't know what they're doing now, and I have some follow-up on that, but I just wanted to state that I know with these saliva tests, they have been FDA approved, but they have not received their barcode, and that was as of Thursday last week.
I remember about you, Council President. So my point is, we also, Dr. Prasad and Madam BA, Chief of Staff, for all the people that they tested positive, or whether they've been quarantined for 14 days, they've been in the hospital, they've come out, how do we know that they are clear? Some are supposed to test again to see if they're clear. We need to understand what that process looks like, if 14 days was enough or it needs to be extended. I know some people that 14 days was not enough and it needed to be extended. Are they back in the general population amongst everyone? What are we doing with the individuals that have tested positive, and what is our follow-up procedure with those particular individuals as it relates to the general population? Because in most cases, if they go, they get tested, what I'm being told, they go, they get tested, some of them are sent home to take Tylenol or whatever. After the 14 days, how do we know that it's out of their system if no one takes another test to say now you're negative? Like what follow-up process or protocol is in place to, I see Chief McDermott raising his hand. What do we have in place to clear us from that?
Madam President, if I could, there's a couple things going on. First, with the saliva test, they were going to kill us. They weren't accepting any insurance. It was $120 per test. They were taking no insurance. And we were in, with Della, we were in at the saliva test on the ground floor. And they're like, yeah, no insurance, it's not approved. Even if it was symptomatic, they weren't taking insurance. $120 a test. So it became an affordability thing. Just to do police and fire department alone, it was $88,000. So that's why we chose to go with the swap. It cost us nothing. Secondary, for the councilwoman's query with regard to what are we doing for the afterwards for the exit testing. I know right now I'm working with a doctor on antibody testing as we speak. Antibody testing will do several things. First, identify who has had COVID and has built up the antibodies, and they can donate plasma to help people out to build immunity. That's the first thing. The second thing is that's actually, you take that into financially, that becomes $40 per antibody test. And not just that, but if we can get that, I can get that reimbursed through FEMA, and it would work out to save lives because we can find out who can donate plasma. So there's a lot of benefits to it. So, I can say one thing as far as the testing. I know the mayor, Della, myself, Director Spezial, we were on this very, very quickly. As far as the testing, we got well over 500 tests. I think approaching 600 tests helped really cure the workforce and get the workforce right. As far as moving forward with seniors, I do know that OEM is working with Health and Human Services with Director Castillo, and they're working on getting CDC doctors to get into the senior centers as well as the shelters, starting with the infirmary at EVAs, to get people more testing. So it's a very dynamic thing that we're also at the same time working on getting surgical masks out to seniors and shelters to help limit the community spread. We've given out thousands of masks to try and at least curb the community spread. But when you talk about the high density of Paterson and getting this testing and the hoops you have to jump through, now we're at the point where I can get my hands on tests. We had very limited, and I believe that Della hit it early, we were very limited with the amount of tests that we had access to. So now the tests are becoming a little bit more open and plentiful, and we can get it, and the different styles of tests, but I still believe that that Rutgers test is going to be financially not feasible at all. And we can't guarantee that that is reimbursable through FEMA. So, I have to get, we're working that out with the application company. Is hopefully we get that RFP open tomorrow, then we can move on with that. But
right. So Chief, you touched on something, right? And I have much respect for you. So I don't ever want you to think that I'm coming or being disrespectful. But it's interesting how you're giving us this information, and this information should be coming from the administration and from the department, so we know. So we know that these things are. So when our seniors call us and they start saying to us, when we have individuals calling us because they put information into a 211, into the Paterson Plus app, and the issues are not being addressed for our seniors and our homeless population, we need to know that those programs are in place. and we don't know it. So Chief, you're mentioning it, this is great, but it would be good if we as a council would know this information.
Well, I think I'll take that from me through the OEM, because I do oversee OEM, but we are being very aggressive in getting the word out.
And I'm sure you are.
There's phone calls going multiple daily to the shelters. There's a lot of interaction with the shelters. That's where we focus, because that's probably the worst type of community spread that we'll see. Ancillary to that, the senior centers, we've been working very, very strong with that. Chief Gardner and Director Castillo, they have been literally day in, day out getting the word out and doing their best to try and get infirmary set up, get doctors in to do assessments, and hopefully we can get the testing. We got to make sure it's financially feasible, make sure that we have the opportunity to do it. I have a model to set up to perform off-site testing, so we're good there. So, you know, something like this where this pandemic stuck up and at the same time that we have to get the testing going and Dr. Paul has to get all these, do all the trace mapping, you know, we had thousands of emergency calls and we've had, you know, they talked about the death rate. Dr. Paul is very much on point when he relates that the death rate itself of people that are dying in their homes is not being appropriately reported, and that's not his fault. That's with the ME, with the hospital. I know since April 7th, the fire department has seen 41 DOAs in the field. So that is obviously not being adequately reported, and Dr. Paul has no control over that. So, you know, we're getting a handle on the response, and at the same time, we're getting the word out to everybody, getting the masks out, working on trying to get this testing ramped up, and at the same point, you know, stabilizing our workforce that was for a good while was hit pretty hard, pretty quickly. So, you know, I believe we have the handle on that now, but if we get the word out, the OEM will do a better job of getting more information out through the administration.
Thank you very much, Chief. Councilman Jackson?
Council President, so very quickly, and I too, I want to give you a great deal of credit for finally roping this. Then I've been making a fuss about it, and I think that it's definitely needed. But I really want to make sure that we don't drop the ball here. And I, just as you, have an enormous amount of respect for the fire chief. It's obviously he's extremely highly competent, but today's meeting is not an administrative meeting. Today is the Board of Health meeting. We are convening as a Board of Health. And at moments of crisis, the person that comes forward to lead the charge is supposed to be our health director. So when decisions are made that directly impact our community, it is very much so all of our concern. Because when you look at the fact that a testing site was placed in a community where most have access to health care, most have the affordability of transportation, and they take it out of a community where all of those elements are missing. So when you look at the national numbers, and to Councilman Abdelaziz's point, yes, the African American community has been hit the hardest. Why? Because historically, all of those elements have been very relative and pertinent in the African American community. Limited access to health care, limited access to transportation, and then for the seniors population, those who we rely on greatly for votes are ignored. They're left stranded within the confines of these large senior buildings without the adequate testing. So I want to make this point and make it very clear. The federal government provided funding for this activity. So it is very irresponsible for us now as a cash-strapped community to look for Paterson taxpayers to foot the bill what was already provided by the federal government. And those other communities, yes, Wayne included, they can lean on us to house all of the county buildings. They lean on us to provide the facilities that are non-taxable. But when it came to a public health crisis, they wanted to snatch it from the city of Paterson and place it in Wayne, and that was very irresponsible. I do not want to move forward without spending a good enough time and looking at that closely, because Paterson people, once again, were shortchanged. and we're putting, and we have a, we not, and, you know, I wish I would have had an opportunity to speak to him prior to. I only read the article moments before we got on the, on this call, and it was very, you know, that article says it all. And furthermore, Council President, what I definitely want to put a focus in on is because this meeting is supposed to be the Board of Health, we should have had the limited number of members because, one, it's being aired publicly. The public deserves to see the commentary of who's speaking. And I don't know about the rest of you, but the connection was very poor. I had difficult time at times hearing everyone speaking. Right now, I can only see the council president and Ms. Fisher. She just popped out. And the public doesn't deserve to see it this way. The public, who is very terrified, you know, members of the administration in certain offices who are being asked and more or less forced to work under these conditions while other members are working from the confines and safety of their own home. It's very disappointing. It's unfortunate. And once again, it's primarily Paterson residents who are shortchanged. It's the residents who don't live in this, who live in the city, who are forced to come to work every day and work with this uncertainty. Because just like you talked about, Council President, it is extremely important, but we gotta understand the roles. Dr. Paul's role is giving to us the data that comes directly from the cities, from the reporting agency. Now, we have on staff that we pay a great deal of money from, and I have yet to see any results come from that hire. I'm talking about the statistician. This is just
incorrect.
Please do not interrupt me, and you can answer when I'm done. But we hired a person to come in and monitor, collect, and bring in data. We move into a health crisis situation, and all of the data in which you're talking about, how many employees have been impacted, how many people were reported infected and recovered. Is that not data management? We're asking our health director, who is responsible for taking care and making decisions that's relative to the safety and the well-being of people's lives, to be a data management system. That's not his role. We want people, it's just like everyone in the community expecting council people to do the role of the mayor. Everyone has to know and understand the roles and the responsibilities of people who are tasked to do certain things. He's telling us clearly, he's regulated and mandated by state guidelines. What he's doing is following the tasks that he's presented with. We hired a person to manage data. All of that data should be readily accessible. What more important issues do we have now than the data of how many employees have been impacted? How many employees who are non-residents are impacted? How many people at DPW were tested? Because I see all of the other offices being tested, and yet I got DPW employees calling me saying, "Hey, Mike, I can't get equipment. I haven't been tested," and we're being told that we have to go to work.
One second, Councilman, I don't know who's calling you, because if there's one thing that I know for sure, okay, is that one of the things is, let me tell you, Councilman, even before we had the test site with the chief been doing a great job. I was telling the administration, is there a way we can get money to get all of our first responders tested? They are not Madam BA Corporation Council. That was something I kept saying. And then I was like, no, it was a money issue. And then when it did happen, okay, and the chief went out there and was aggressive doing it, one of the things where it was not just for police and fire, it was also DPW, and then they opened it up to other employees. So whoever gave you that information, not true.
Council President, I've spoken to numerous employees in the clerk's office, in the tax office, in City Hall. I've spoken to members of DPW and not one of them have told me about a testing situation where they've been tested for
Wow, that was
COVID.
open, it was open, toucher. Okay.
And although I've heard consistently about police and fire being tested, I've yet to hear about DPW. I heard about the Department
DPW
of
was open,
Recycling
Councilman.
being shut down. Okay,
It's all DPW.
well,
Okay. 1 second, what did he say, Chief?
We offered the testing on the Monday, 2 weeks ago, all DPW. They were all, we had 9 out the door.
You offer 2 days, Chief. You offer Monday and following Thursday.
All right. Thank you, Bill.
And just recently,
Councilman Velez. Councilman Velez has been waiting patiently. Councilman Velez. Hold up, Councilman. I got you muted. Hold on. I got it. Okay.
I put myself. Once again, you know, if you gave me the opportunity to be the second one to ask question to Dr. Pizat. If you have noticed the question that I asked Dr. Pizat, everyone that has spoken aligned to those questions. I don't know if he have those questions written that he could bring without a big scenario regarding why this and that, but those questions was on point. It was with real numbers asking, and I think if you bring highlights in those questions, bringing the information out, I think all of us will canalize our emotion, our ideas, and move forward in this meeting. And I understand that. I understand that my colleague Mike Jackson had mentioned 5 times the Director of Human Services. And I believe she was directing Director of Sheen. But in this case, what I see is that, and with all respect, Councilman Jackson, is that Dr. Prasad is the epidemic doctor from the Board of Health.
He's a health officer.
Health officer, that she relies on him to do the work and to do the right thing, and they have communication back and forth in this situation. Now, it's no different, okay? In the past, we used to have different directors, and Dr. Prasad was the board health official from the city, and not only from this city, but surrounding city too, that's my knowledge. So if Dr. Prasad could recoup all my questions, and I know that all the questions that have been done today falls in all the questions that have done it before everybody interject. But if you have those line that people can understand, then we could move forward, because I see Director William Rodriguez here meeting, and I believe that there's a lot of questions for him too regarding sanitation and other stuff. So, but if you have, and if you could answer me,
Yes.
if you could answer me at least the critical question that I asked you, that people are paying attention out there regarding this numbers and why and the recube and not recube on the ventilator, please bring us this information, for we could probably sit down and have an aggressive approach moving forward. Because if I go 3 weeks ago from this pandemic started, okay, I did some recommendation, and probably those recommendations were taken care of, and probably the number will be lower. But I'm not a health official, but you are. Please answer those questions. Probably I can line moving forward what we could do from here.
I'm ready to give you some answers, Councilman.
Thank you.
Okay, so a lot of the questions you asked were related to hospital and recuperation from hospitals and hospital cases. But it does not fall within the jurisdiction of our local health department. The health officer does not have access to those information. I want to repeat again that our role is defined specifically by the State Department of Health. I have to basically walk in a lane, and that is meant, and that is, and I understand that based on the sciences. So a local health department, what we do in terms of this infection is limited to one thing and one thing only. That is the epidemiological investigation of cases, not negative and only positives. So if you have 20 people that test and 10 of those 20 become positive, what we do, we investigate those cases, we follow them, and we establish a quarantine period, and then we follow them through that period to see how they're doing and how they're improving. Now, if one of those cases happen to die that we are following, that is how we will know that this case died. But we will know that because we were only following that case. But let's say a case died at home and that case never tested, or that case went to the hospital and died of something else. We do not get involved in that. That's the health department is not tasked with doing that. So I can only do what I'm tasked with doing, right? So every day, when a county health officer, for example, calls me and say, "Do you have any deaths today?" I'm hearing of deaths in the community. I do not have the information because I do not have verified information to give. And neither does any health officer. And I'm going to give you an example, Councilman Velez. On Sunday, I spoke to my counterpart in Wayne and Passaic, and he's the health officer for Wayne and, not Wayne, for Clifton and Passaic City. And 2 weeks ago, and he told me 2 weeks ago, I was in a problem because I spoke to my mayors and I couldn't get through to them why they're differing numbers. And I explained to them, what numbers do you want? Do you want the numbers from what is the system is saying, or do you want the real numbers? The real numbers of cases now are what we are giving. Simply because when we get cases, we work on those cases. And when we work on those cases, those are the real numbers. If you ask any of them,
I'm sorry, I need to interrupt you for a minute. Dr. Prasad, I need to interrupt you for a minute. You're making no sense when you say that you have the real numbers. And just the hospital alone, just one hospital, gave you an exact amount of a number to you. Coronavirus is coronavirus. If you die, every death certificate has a reason of why you died. Okay, listen. If the hospital's giving you a number and they said 86 people died of coronavirus, that is an actual number. You can't tell me that you're giving a real number when you're giving less than what one hospital gave you. Now, granted,
we're talking apples and oranges, and I wish you would listen more so you would understand. But
I am listening, and what you're saying makes no sense.
No, yes. I'm not
makes no sense.
That's what I'm going to say is I'm not disrespectful to anyone. But since I started this year, all you keep doing is interrupting me with your own agenda. I'm not
It does not make sense what you say. It does not make sense what you say. That is the reason why I will interrupt you. That is the reason why I will interrupt you.
Councilman?
Madam Dean.
I know for this particular example, it might just, I know part of it is that those numbers were just given to Dr. Paul either over the weekend, I think he said, or today when you were on that call. Those numbers don't always come in real time. So the last time we got some numbers, but I just wanted to clarify that one point.
Madam Dean, if you heard him, he said he was getting numbers from the hospital from before.
So, Council President.
At the end of the day, all I'm saying is this. When I hear Dr. Prasad make a statement, and he's saying he's giving real information, right? And then I hear that there's other numbers specific to Corona. I understand he has to do his thorough investigation. I understand that those people that are passing away in their homes, some of them may have not been tested. He just said right now, he's not following all of them. Only the ones that he gets is the ones that he follows. I get that. But for him to make a statement, okay, that he's giving the real information, that is inaccurate.
So, Council President, I got a question for you. I got a question for you.
Councilman, hold on a minute. Councilman Rivera.
No, hold on, and I'm finished.
Hold on. Councilman Rivera.
It's a question for you. It's a question for you, Council President.
Councilman Velez.
Okay. Now, we've been here since 5 o'clock in the afternoon, Council President.
We didn't start the meeting at 5, but go ahead.
All right.
And I said it, and when I started the meeting, I said, you know what? Everyone's gonna put their points, okay? And there's certain things that I wanna see done. We're gonna leave this meeting knowing that there's an action plan. I don't see the plan.
So this is like...
Chief of Fire said that there's some things in place for the homeless. Okay,
This is my question. My question is, Council President, I've been watching the governor brief every morning, Saturday and Sunday. And this is the governor in the middle stage of it, orchestrating a fact report moving forward. Has his Secretary of Health, has the state police, has everybody sitting there just giving report what you have done, what is going, what is moving forward, what we have. In this meeting that I have here, we just asked a question and everybody acted like they don't have information. Why everybody did not get ready for this meeting if it was announced since yesterday and say, Dr. Prasad, this is what we want to know. Dr. Chief of Police, this is what we want to know. Fire Chief, this is what we want to know. Administration, this is what we want to know. Give them a series of questions and they come ready, because right now, we like a COVID Watergate investigation here, and we don't want to go here.
Okay, and you're right, but you know what? This meeting needed to happen. Okay, this meeting needed to happen.
Agreed.
And you know, I won't allow someone to come and think that I'm disrespectful. Okay, you know what? For months we've been asking the questions, and it is obvious to me that if we're asking the same questions, it's because we're not getting answers. Okay, people are dying in the city of Paterson. You mentioned the state, that's great. The state is doing a great job reporting numbers, but the city of Paterson has a problem reporting numbers because every day there's no numbers being reported. We have a dashboard that will be updated, but sometimes the information for 7 days went with no numbers being increased. How are you going to tell me that our numbers continue to increase, but yet our data information on the dashboard isn't changing?
The state is reporting the people have been eating eggs.
Okay, so Councilman Rivera.
So, you know, we somehow gotta be embarrassed, you know, when things like this go down in certain meetings. That's why I didn't want to have Dr. Paul come in tomorrow's meeting, during the regular meeting, and actually have a meeting just to have a conversation with the health department. But I just want to point out to the people that are watching this, and the administration also, and the rest of my colleagues, that we're also elected officials. We're two governing bodies in this city. And we're not being included in a lot of the things that are going on. Information is not shared with us. This has been an outcry for 2 years now. I've been complaining about for 2 years. Before I became a councilman, I used to watch council meetings, and other council members used to complain about other administrations not providing them with information. This started way before, even when the executive order was done. We were not included at all with any of the information. We called the mayor to a meeting one time, and this is not about the mayor. We called the mayor to a meeting at one time because we didn't know what else to do. We continued to ask for information, and we would find out through social media. And it's on YouTube. You can look up the meeting where he said, "Bro, you guys got Facebook and social media. We should not be communicating with this. All we're asking for is for information so we can provide it to our residents also. You know, we get calls, and also to strategize, to see how we're going to tackle all of those things as a team. Not as the mayor, not as the council, as a team. Now, let me ask a relevant question now. I hear some complaints that 199 Carroll Street from the senior residents. They're scared, they have a lot of concerns. I believe this building is owned by the housing authority. So Dr. Paul or the administration, I'm not saying that it's Dr. Paul's job to do this. Have we been in communication with the housing authority to see what measures they're taking to make sure that their buildings are disinfected Because I hear a lot of them are dying, well, I don't want to instill panic out there. There are some residents that are dying in those buildings, right? Oh, and there's others that are just, that have the virus. I want to know, what are they doing? Because what I'm being told is that they don't see them coming in to disinfect those buildings. What are we doing as a city to make sure that they're putting the resources in place to clean those buildings?
So, Madam,
And again, so public, I want to apologize for what has transpired here, but this is the first of many meetings that we should be having, not just during a pandemic, but we should maintain, and this is something that Councilman Jackson has been talking about for years, and even Councilman Velez, I read an article where he teamed up with Councilman Jackson to recommend this meeting from happening. Then I jumped on the bandwagon because, it's easy to complain all the time and say, how come we're not getting the information from the administration? We continuously ask for information, but you know what? We used to use our power. We need to use our power to make sure that we represent our people to the best of the ability that we could. So, Dr. Paul, what are we doing to make sure the Housing Authority is cleaning their buildings?
So Council, I don't know if you can hear me well. I get the impression that sometimes the sound is not working in my system, but if you're hearing me well, let me explain to you that since the beginning of this outbreak, we sat together with the administration and we came out with a number of prevention measures, and we've done everything we can to send out information in regards to prevention. I was very concerned about seniors from Orion. I worked with the mayor, so we did actually we sent out a lot of information. We also put information on senior buildings. We do that.
Director Castillo, answer.
I'm gonna have Director Castillo, who is the Director of Human Services. I think that question should be answered by her. Director.
Thank you, Madam President. So we've been in constant communication with the Housing Authority as well with the administration of all of the private buildings, quote unquote, because they're not under housing. So each building is making sure that they clean their buildings about 5 times a day. And those are in the edges. The other common use areas, so the doors, the elevator, they're being cleaned every hour upon hour. And we have constant communication with them as well. A lot of these buildings are also not allowing visitors to come into the building in order to make sure that the seniors are protected. So just as we've been delivering the food, it gets handed off to the administration of that building. The administration cleans it and divides it, so guests aren't being allowed in. They're also checking with the seniors 3 times a day. So most of these buildings have phones inside, or they're knocking on the door to make sure that they're doing okay.
I appreciate that. That sounds great. But my question is, are we verifying that this is being done? Because I'm just relaying a message from the residents, right? Maybe we're being told one thing, and maybe they're cleaning a lot of the buildings. But I'm giving you a specific address. Yeah.
Yeah, we would definitely look into it and revisit that. But every week, I have a conversation with the Housing Authority Director and with my Senior Services Director, Ms. Diaz. She's constantly hearing from the administration. They have their weekly calls to make sure that this is being done. I will look into that building just to make sure. But since a lot of the seniors are also in their apartments and they're not really leaving, they're not seeing what's happening outside. But we will definitely look into 199 Carroll Street, you said, Councilman, correct?
Could we have a log? And again, I'm not telling anybody to do the job. And maybe so people, feel more comfortable. Can they have a log, basically stating when was the last time they actually disinfected the buildings? I don't know if that's we could do that, but I think we should do something to monitor them.
Absolutely. Absolutely. I'll talk to the Corporation Council if they allow us to do this, which we've been having a great partnership with them. I don't see them now, and I'll definitely get you that information.
So, Director Castillo, I have another question for you. So now that you're speaking,
yes,
so that's for seniors. I want to know, what is it that we're doing for our homeless population? Okay, I want to know the exact plan of what we're doing, because it is obvious there's a correlation there with COVID, homelessness, mental health, please tell me the plan, because none of us know what the plan is. And there's a perfect example. I want to commend the gentleman who saw something out there, and obviously to see something, say something, and took it upon himself to make what we thought was the process. Call 211 to report it, okay, and put it on the Paterson Plus app. And nothing was done for hours.
Yeah.
15 hours later, okay, I happened to get myself, go forward, okay, and the person was taken care of. And then I called you and I spoke to you and we had a 40-minute conversation and you explained to me, Council President, we have a plan. Why don't we know the plan? Please tell me right now what that plan is to combat the situation that we have with our homelessness, COVID, and mental health.
Absolutely. Absolutely. First of all, I want to thank you for giving me a call yesterday. Because of that call, we were able to make a few additions to today, which I'll get to. So the first thing that I tell the community, we do have a large homeless population in the city of Paterson, and we've seen it more so now. We do have seen people move from other cities, or where they've been released from the hospital, or even from the jail. So it has gotten a little complicated. The police department and the Department of Health and Human Services have partnered to help our homeless population. That's why I always tell the community, if you have a homeless, we prefer that the police department is called, because they are the trained individuals that will then contact the person, let them know, if they do want shelter, because it is very important. We can still not force a person into shelter, even through this crisis right now. It's very unfortunate, but it's the truth. So the police department will arrive. Director Spezial, does have the COVID units, or a regular cop car will show up. They will call 211 and get the process started. I know there was a miscommunication on Saturday, but remember, this is not the city of Paterson's line. It is a state line. It was previously had by the county. Now it's the state of New Jersey line. This is the line that we are mandated to use. We've been trying to find a
What's the line? Say the line. What's the line? What
211. 211. 211.
No, it wasn't working. It was broke.
I'm sorry?
I said, we understand by what happened this weekend that is not working. How are Pattersonians? What is the plan for Paterson?
We were able to place people, even this weekend. The 211 line has added additional personnel only to handle Passaic County calls. And even then, after the conversation with today, they will be adding additional personnel. But the county has the CSBG dollars, CS, Community Service Block Grant, as well as the SSH, the Social Services for Homeless Individuals. So they are the only department with a homeless plan and a homeless board, technically per se, homeless council. So they are paying, or they're the ones financing the sheltering for homeless individuals within the county. So
give us the plan, though, Director, please. Give us the plan. What's the plan?
You call the police department calls 211, they do the intake, then 211 will send an Uber to pick up this person for transportation, and they will be placed in a hotel. And the next day, they will be followed up by Board of Social Services for additional services.
Okay, so they will be, so you obviously, these are the ones that say yes. These are the ones that,
And also,
okay.
they did two of them. I actually got a text and spoke to the director and handled the one at the college. And Chief Cora just did one today on Van Houten. So we used it twice. We used it the day before, and then we used it again today.
Okay.
We did use it.
Yeah, and we're adding additional.
We do have the card.
Yeah,
Okay.
there's additional flyers. Individuals that don't want their services right then and there, on places where they can access service, or if they see a police officer, or if they do have a cell phone, who they can call just in case they change their mind.
We have a lot of homeless people that don't have homes.
Correct, but there's places that they can attend, whether it's EVAs during the meal time. We are working with an agency to bring them on board to do additional outreach. As soon as that gets confirmed, then I will let give you guys that information, but they will be out in the community as well.
Okay, so, Director, I would like that plan of what you said. I would like to see something written out and sent to all of us. Okay, Councilman Rivera.
Listen, we could speak all night, but could we conclude somehow by asking, what plan are we gonna have in place? Because that's what we're here for. What plan are we gonna have in place to keep us informed going forward? What our challenges are as a city? That way we can all sit down and have a conversation. We could discuss certain things in finance. But we need to have a plan. We need to all work together. And so far, we have not been included in anything to do with this pandemic. And I could speak responsibly, I could pass that comment, and that's just me. I can't speak for my colleagues, but we have not been included. So what I'm saying is, the purpose of this meeting is not to bash to Paul or anybody else. We need to know what are we going to do as a board now, as a health board. How are we going to be informed going forward? And Council President, I believe that from time to time, we're going to have a meeting, but it has to be, again, this was the first meeting, we didn't know what to expect. But it has to be more organized, and we have to have basically an agenda to see what we're going to discuss. But again, we need to understand what the needs of the cities are, what the need of the health department is to address the issues that we have. How are we tackling things? Just because the state numbers have gone down doesn't mean that the situation is better in our city. We need to understand everything, but we need to have that conversation. And also, don't forget, as a health board, we get a lot of concerns from residents about certain things that we could bring to this board. Instead of bringing it to a regular council meeting, I could just go to the people that could actually address the situation. So, will you please, analyze this somehow?
All right, so I will say this to you. So you're correct. We do need to leave here with a plan. I'm actually getting messages from seniors saying that it is not true, they are not cleaning. Just so you know, Director, this is the messages I'm getting right now, they are not cleaning. Okay?
That's the president. Let me tell you something.
Councilman, can I just finish?
Because the thing is that Councilman Flavio brought something up, and I had to concur with Director Lachine because I was at 199 Carroll when they was cleaning the building this past week.
Please don't take this personal, Councilman. I just got a text right now of a senior, and it's not one
The problem is, Council President, they've been cleaning the building, and an hour after, 2 hours after, people are coming into the building, they throw the glove on the floor, they throw the glove all over, and the senior think that they're not cleaning.
Okay, Councilman, you interrupted me. Councilman, you interrupted me, so give me a second, okay? This is, the text was not for 199, Carol. It wasn't. It was another. So you took offense to something, you jumped, and that's what I was saying. Please, Councilman, because the text I got is from another senior housing.
You didn't say that. You didn't say that.
You didn't let me finish, Councilman. We can't go back and forth. I'm telling you, wait.
I defend my
mind. So what I want to finish with is this, okay? It is obvious, okay, that there's a lot of loose ends here. But the reality and what we're here is that we know that we want the best for our Patersonians, and that we all have to work together, and that we have to know what that homelessness plan is, okay, because our numbers will continue to increase if we don't address those issues. And not just giving them housing for 30 days or 40 days or whatever during the pandemic. It's what do we do afterwards and the follow-up. The same as the numbers, the data, the information that we're not getting. I want to receive, and I am going to put this on record, and I wrote it down, okay, of what I'd like an investigation done, okay? And through the county health officer, I want to know, since we started this, okay, what the exact Paterson numbers are. I don't want to hear, oh, but I only get a certain number. I want to know the numbers up to date and understanding that they fluctuate and that they'll change some. Okay? I want to know the number of how many have been tested in Paterson.
President, can I?
How many, 1 second, how many have been tested, how many are positive, how many were negative. I want to know how many have passed away. Okay, these numbers should come from all the hospitals. Okay, and what was the other thing I wanted to know? The numbers of and starting from mid-March. Okay, starting from mid-March, I want it till date. There should be no problem getting that information for us if there's a central place for this information. Right now, I'm putting it on record, we have a health officer. He should be able to get me this information up to date. And that information should be matched with what is being put on the state level. You can't tell me that, and Dr. Prasad was in this meeting this morning where he was told that there is one entity in the state that receives this information. One entity, and that he has access to that. Okay? And the other thing I want to ask is, we have a department that, my father passed away in Paterson, right? And I got a death certificate. And that death certificate stated, okay, what he passed from. My father had cancer, right? So, isn't that under the health department, Dr. Prasad? That department vitals? Dr. Prasad?
I'm listening to you. What's the question?
I asked you the question. Is that department under the health department?
What department?
The vitals, where you get your death certificate from.
Vital statistics is a part of the health, of the Paterson Division of Health. Yes. That answer that question, yes.
Okay, so wouldn't you be able, as the health officer, to be able to access information of our death certificates?
I cannot give you information of any death certificate, or that's confidential issue.
No, Dr. Prasad, I'm not asking you for names. Dr. Prasad, there you go again.
I'm not going in there.
I'm talking about numbers, Dr. Prasad. I'm talking about numbers. When you say that you can't access numbers, that you have real numbers, that your numbers are the real numbers, okay? So you have a department that houses those documents. You should be able to say, you know what? The vitals department had 100 death certificates issued, and out of those, 50 were COVID. You can, that information you can get.
May I respond to that? May I respond to that? May you give me a chance to respond to that? Because I need 30 seconds to respond before, right? And please do not confuse cases and deaths. You've been doing that all night, and I have to call out to that, Council President. You have been, when Councilman Perez asks a question, I'm talking about cases, and you jump to death. You have, when you're asking questions, you have to be very clear.
Answer the question. Answer my question.
Hold on, can I get a chance to answer? Can I get a chance to answer my question, please? So, we do not have death certificates with regards to COVID, and I can tell you how many cases we have or not. We do not have that at this point in time. We do not even know some of those death certificates were generated, is it? You're asking for questions not even the federal government have, and you need to understand what's going on before you ask questions. I think you're not very clear. You're putting me in position whereas, to give you answers that I don't have, the government does not have.
And that's what you need to say. I don't have those answers.
So I'm telling you, I have numbers of cases, and I stand by those numbers. And you have to be able to differentiate between cases and deaths and apples and oranges. You have demonstrated that you can differentiate between cases and oranges.
Tonight, you have demonstrated, Dr. Prasad, that you give that information to us. Tonight, you cannot have information. That's what you did today. Okay, you talk about apples and oranges. When you talk about cases, that's one thing. I was asking you for numbers. Real numbers. What? And I said that the numbers of deaths did not match what we were.
You do not have numbers of death. I've been telling you that. You heard that this morning in the call from St. Joe's Hospital. You heard what you want to hear, and then you come here to try to bash me. You cannot bash me. This is not a bashing.
Dr. Prasad, you're taking this question.
You have to know what you're asking, and and then we'll give you
I
answers.
know what I'm asking. I'm asking for numbers. I'm asking for numbers.
You are asking me questions, and you don't have answers to.
I want the people of Paterson.
You want to go to the state, I do not have answers. Do you want me to explain
I want
that?
the people of Paterson to understand and why I'm asking for numbers. I want the people of Paterson to understand that the reason I am asking for numbers is so we can let you all know that we have thousands of people that are infected, that you need to take precautions, stop hanging outside, stop the drinking, stop the partying. This is serious. This is why I am asking for this information. You're taking it personal. This is not about taking something personal. This is about informing the community and being accurate with the information that we need to provide to the community. Okay, this is what it's about. Okay, okay, that this is about apples and oranges. This is not about apples and oranges. This is about providing the information to the community. And that is all that I want. I want to be able to have a plan in place because I feel that right now the alarms are not sounding loud enough. And this is why we continue to have people hanging outside. Well, only 60 people have died. You know what? Out of thousands, only 60, that's okay. I can still hang out. I don't have to cover myself. I don't have to be 6 feet away from somebody. This is why I'm sounding these alarms. I, in January, reached out to the mayor and to the health officer, and I said, can we start doing things, preventive measures? What preventive measures do we have? And I was told, just look at my Facebook. Facebook isn't enough. When I look at the health officer and a video that he put forward, and that he has 1,000 hits, that doesn't say, that only says that 1,000 people saw it. How about the rest of the 148,000 people in the city of Paterson? How are we communicating to them? What are the metrics used in place to address these issues? We are not doing a good job, and I'm sorry, Dr. Prasad, if you're taking it personal. This is not about you, Dr. Prasad. This is about the process. And the process is broken, and this is why I am very upset about it. Because we are not doing justice for the city of Paterson. I'm sorry, we're not.
I'm not taking anything personal. But what you've done tonight is you tried to handcuff me by muting my mic so I cannot respond, and then I'm trying to respond to someone specifically. You interrupt, you get involved, you come in you're mixing up numbers. You ask for numbers, but you're not specific numbers. The numbers you ask me, I don't have them. The president does not have them. The governor does not have them. This weekend, New York changed their numbers by 3,000. You're dealing with, you can go to the State Department. Do not have to take my word for it. But I'm telling you, you're confusing yourself. You're confusing the issues. I'm explaining to you what are my limitations, what I do to help offset, what I can do, what access I have, where's my lane. I'm licensed by the state of New Jersey. I'm not licensed by the council president. And I'm not going to allow my license to be taken away because I acquiesce to give you information that I'm not supposed to or not privy to.
Data. I'm asking for data that you should be able to
Dr. Prasad, Council President, I have said it before, I'm giving 2 almost 3 hours to this conversation tonight. I think it was very needed conversation, great dialogue. I'm putting a lot of recommendations and concerns out there. I pray that, I know Madam Clerk is on, I'm not sure for Secretary, that they've taken everything that I've stated, and there will be some follow-up sooner than later. But I am going to remove myself from the call. As I told you, with what our family is experiencing, you wanted to come on because I knew this conversation was important, but I need to come off of this call and deal with some other concerns. So God bless all of you. For our great city of Paterson, please keep our family in prayer as we go through one of the great losses in our family. God bless you and good night, everybody.
Good night. Good night.
Madam President, before Councilman needs leave, yes, I'm taking all the notes.
Thank you, Madam Clerk.
I have everything here.
Okay. Thank you, Councilman Khalid.
Okay, thank you. Administration or the health officer, I think the information is very important so that the residents of Paterson take this pandemic seriously. And about death certificate. Without the death certificate, you can't even do the burial. So you should have the number. It's easy. Definitely there is a state website out there. Without the death certificate and the cause of death, you cannot even do the burial. Simple as that. So numbers should be there. And only 60 people, and St. Joseph reporting 86. I'm not saying that Paterson residents going to Hackensack and go to the hospital, any other hospital as well. So I think we need to inform the residents with the correct numbers. So these people out there, the residents of Paterson, take this pandemic seriously. That's the only thing we are asking for, Dr. Prasad. That's all.
May I ask you the question?
Councilman Khalid, thank you very much for.
May I ask you the question on the numbers from St. Joseph and the deaths? May I get a chance?
1 second. Dr. Prasad, 1 second. So I want to thank you, Councilman Khalid, because you are correct. Just to clarify, when I stated about the death certificates, at any point was I requesting people's names. I was just talking in terms of numbers. That was it. I want to hear from the health officer that he says, you know what, I'm going to try my best. I'm going to contact the state, that entity that I can contact to get the number of people that have passed away. I'm going to do that. I'm going to work with all the entities to at least come and have a better, precise number. That's what I want to hear. I don't want to hear the back and forth of what you can and can't do. I'm not asking you to do anything illegal. I'm asking you to help facilitate. And as the health officer, who's the licensed person, you should be able to say, with my 35 people on my strike team, because you said 25, but then you said you've added more, how about delegating some of this information specifically for that? Somebody to say, you know what, you're going to be the contact and contacting the state and getting that number of how many people have passed away and how many were, because there's one thing, a number of people passed away, the other is who passed away from the virus. Again, this is so we can continue to sound the alarms in the city of Paterson to take it seriously. Dr. Prasad.
May I respond to Councilman Khalid? Councilman Khalid, what happened is that, as I mentioned earlier, we got a list from St. Joe's Hospital of the of a spreadsheet with the number of deaths, and we were already aware of a number of deaths we had. So what we did is we took that spreadsheet and we cross-checked it with what we had. We took out what were duplicates, and then we came up with that number that you see that's on this city tracker. So we sent a request again to all the hospitals to give us this number, because usually we would want to know these numbers. However, St. Joe's sent us another spreadsheet this weekend. But usually with these spreadsheets, as you have to be very careful, so that we have to check and see if any of the deaths on that spreadsheet is a duplicate. So when I give numbers to the administration, the number is scrutinized. I do not want to give full number and print and give the administration. We do due diligence with the number and make sure I can cross-check it. And we are doing that currently, and then I'm going to come out with a number. Now, deaths are reported in the state surveillance system. At this point in time, we do not have access to the state surveillance system to extract the number of deaths. We are looking into that. This morning in our meeting, we discussed that, and someone from my team is reaching out to the state health department to find out a way, if number one, if we're authorized to do it, because at this, I don't know if we're authorized to do it. Number two, if we're authorized to do it, so that they can walk us through, so we can get that number. So this is what we're doing with what we're doing now, because some of the other hospitals told us that they just inputted numbers, they just inputted information into the surveillance system. So the surveillance system is not owned by the city of Paterson. The surveillance system is not controlled by the city of Paterson. The surveillance system is controlled by the state. So they give us a certain amount of access. We do not have broad access to the surveillance system. We are charged with only doing certain things, and we have to stick within those guidelines because the State Department of Health authorized after training and after taking exams, they authorized a specific number of people from our team to have access to that. So they're qualified. But we cannot get access to certain data because it is not within our control. It is within the control of the State Department of Epidemiology to have that data. And it is not our, upon the state, it is not, it's only what we're tasked with doing is what they allow us to do. So a lot of this information has to come from the state.
How is the state reporting then? If they're not gonna provide that, like, the state specifically reporting county-wide as well?
Yes, the state can report to that. We don't have access to it. We do not have access to that. We don't have access to, if we know about it, then I let the administration know that. But really, we do not have, nobody have access to these deaths because some of them are happening at home. And then the hospitals don't know either. And then they're reported at one time. And then there are many factors that are involved here. We're dealing with an epidemic, a pandemic that nobody could have planned for. Nobody understood this. Nobody was prepared for this. Thank God, which I think that in last year, if we did not put together the team that we put together, we would have been submerged underwater. But because we have the team in place, every day when we get our numbers, they're assigned. I have a great team. So we assign our numbers and we work with them. The number of cases, not number of deaths. We do not work the number of deaths. We investigate cases. We do not investigate negatives. We do not get report of negative. The labs are under no obligation to report negative tests to the surveillance system. Only
Dr. Paterson. No. Let me just say this. You continue to repeat and repeat. You as the health officer, wouldn't you want to know, I have this amount of cases that are being investigated. I have this amount of people that have been passing away. Why wouldn't you want to know the number of deaths?
We are doing that. We do not have I cannot, my job is not to go out in the street of Paterson and count deaths. I have to work.
Nobody asked you that. Nobody said that.
So I'm answering your question. That's not reported. If it's not reported to me, I have no access to that part of the reporting system.
Councilman Rivera.
We're definitely not going to go anywhere, Council President. We don't have the numbers right now. So you go back and forth with Paul. It's not going to solve anything. You can have simple questions with Paul. Just answer yes or no if possible, right? Have you contacted the state for numbers ever, Dr. Paul?
We have not contacted the state for the number of deaths because the state is already reporting that, and we are tasked.
Okay, but listen, Dr. Paul, I'm not putting any blame on you. I'm just asking. If you were to call the state tomorrow, will they provide information to you as the health officer for the city of Paterson?
If I call the state tomorrow and ask them for the number of deaths we have in the city of Paterson, if they have that data, they may share it with me.
So, could you please?
I will do that, Councilman Rivera. I will call the state tomorrow.
So we're heading somewhere now, right? So that's good.
Yes.
In case they can't provide this information, Dr. Paul,
yes.
Do you have the ability as a health officer to call every hospital in the area just to ask a simple question to see if they track the number of infected and death by city?
We did that, Councilman Rivera, and one hospital responded with some deaths, and other hospitals, what they responded with is they're putting it into the system, and that's their response.
Which system?
The state surveillance system is called the disease reporting system.
So the information is from the state, so let's try to get that information from the state. And for whatever reason you cannot get it, then you inform us. If the council and the administration, that you were not successful, and then we need to contact our legislators, take legal action, whatever we need to do, but we need to find out. I'll tell you why this is important, at least the numbers, right? Aside from allocating resources for things as maybe contemplating doing our own testing and things of that nature, it's also important because I'll give you an example. My mother's in her hometown in Dominican Republic right now. At one time, they said they didn't have any cases there, right? But they're not testing that hometown. They said they didn't have any cases. So guess what people are doing? They're not paying much attention. Today, they said there's only like 3 cases. Again, they're not testing in that town, but they supposedly only have 3 cases. Guess what? You still have people visiting other people. We just want to, sound the alarm, but not just sound the alarm. Also, we notice that the administration is not doing enough for our people. We are going to bring the administration to the table and the health department now with this meeting that we initiated today as a health board, and we're going to take charge. And Mike, listen, I agree with you from the beginning. You've been pushing for this, and we just can't leave everything. I understand it is, we're two legislative branches in this government, but we need to utilize our power to make things happen from time to time. And thank you, CP. But you know what? Let's not continue the back and forth.
Yes, we're gonna conclude this meeting.
And he's gonna get those numbers.
Yeah, we're gonna.
The fire chief stated that he's gonna look at some numbers to see, how much it would take for us. I guess he'll work with Dr. Paul to see how much funding and resources we need to do some testing in the city or, whatever we decide to do.
Councilman Rivera, with regards to the testing, and Chief McDermott knows this. Before the City of Paterson Health Department can actually do testing as a health department, obviously the state would want a private doctor to do a test, and that's what actually happened in the City of Paterson. Because a private doctor did the test. Now that doctor can bill the City of Paterson because they have insurance, or they can do. The difference with that, Councilman Rivera, is that once that doctor can do a test and he has his own personal insurance, liability insurance, the City of Paterson has to look at this and approach this very differently, because the state health department gives us our authority. Our authority is vested in the state. The state authority have to be very careful with that.
Jersey City opened up 2 sites.
Right.
Jersey City, so the state allowed Jersey City to open up 2 sites.
And they allowed us to open also, but having a private doctor come and do the testing is different. We have to go through their guidelines, and we can do that. And if we partner with some of the doctors that you say you can volunteer, all I have to do is that we have to run this through the state. We know what testing they're using. They're using that testing that is approved by the State Department of Health to do this, and we can get this done. We have this plan. We planned this out already. So, this is okay.
Councilman Jackson.
Very good. So, thank you, Council President. Dr. Prasad, I appreciate the work you do. Please don't take frustration from any one of us personally, and we know that you're tasked and placed within guidelines of the state regulatory system. So with that being said, Council President, I'm hopeful that, because I agree with you, we do need numbers, and I think that the task should not be put to Dr. Starr per se, because he still has his duty to oversee the health and wherewithal. But I would like to know how many tests did the county administer? And out of that number, and Ms. Fisher, maybe you can take this information down and report it back to us. But how many tests was administered up at the college by the county? And out of that number, how many Paterson residents were tested? And when we talk about the implementation of these tests and how much it would cost, no one ever says anything about how many Narcan services we implement each and every year. It's another expense that we, the city, take on. Again, I want to re-emphasize that the tests that were being provided, or the funding source for these tests, was provided directly by the federal government. Just as it provided outlets for, because I'm hoping tomorrow night we can talk about the impact that it's had on our local business population. And with that being said, Councilman Rivera, I appreciate the sentiments, and I also support you in the sentiment of the fact that we have not been getting what we should be getting back from this administration. It has not been a working collaboratively effort. And when you look at from the beginning of this administration, even the implementation of the sewer tax and all of these other things, when we came back and questioned it, we still have yet to receive answers on these things that are very pertinent to the community. So when we look at the fact that there's key members in our community, and I'll say the overall status, because it was a demand for quarantine. We can arrest people for hanging out in front of liquor stores, but we can't arrest homeless people that are doing the same thing, that are refusing service. And the majority of these homeless people are sleeping on our streets. They're not from our community. So I think there's a lot of numbers that need to be given to the council. Mostly what was administered by the county, and then again, I would like the administration to answer to us tomorrow. Why did it not for Paterson's initiative to start a testing right here? We needed someone to advocate for the city of Paterson, and the county obviously overruled whatever processes our health director in place. That's very disappointing. So I would like to know what are the names of the people that are tested. How much money was spent? How much money was given by the federal government? Because from what I understand, that check was already given. And that check could have been split equally between Paterson, and we could have implemented some additional services. I take my hat off to our fire chief for finding a way to getting our first responders tested. But I see it as equally as important. I know a lot of young children that play in the city. They don't have no.
Councilman.
Yeah, Ryan. Especially you have to mute your line, so there's no.
I know somebody. There's a lot of feedback. I don't know who it is.
Yeah, wait. So
I just want to make sure that I had your. Excuse me. I just want to make sure I have what you're asking, because I want to be very responsible in getting this information. You asked how many tests were in the county, how many Paterson residents tested, not so much whether they tested positive or negative, but the overall amount of people that tested, and how much was spent and how much was given, how much of that which was spent went towards Paterson residents. Am I correct?
I mean, realistically, we don't need to know how much was spent once we towards Paterson. Once we know how many Paterson residents was tested, I mean, total tests were administered. Out of that total, how many was from Paterson? How many tested positive from Paterson? I don't care about all the other municipalities. And what was the total cost of, or what was the total spend? And I'm willing to bet that we spend more on implementing other programs such as Narcan through the year than we was spent on this system that we.
Councilman, I'm sorry, Councilman Al, but let me just say this because I do have to go. My daughter's grandmother passed away yesterday, so I kind of want to give her a little bit of my attention tonight. But I want to say that most of the questions that you've asked will have to be asked outside of our perimeters. So I will be reaching out to those particular agencies and folks to find out some of your questions. I did reach out to the state to find out about the William Paterson site, and I'm still waiting for an answer. You asked a question earlier about who made the determination for William Paterson. So I did reach out for that answer. I will do my very best to try to get these answered tomorrow, the questions to these answers.
Honestly, Ms. Fisher, just for a point of clarity, I don't need to know who made the decision to implement a testing center for the county, because that's their prerogative. My question is, who made the decision here within the city not to implement a testing center in Paterson and allow the county, and just allow the county to do it there? From what I understand, it was already in place to have one in Paterson, but someone obviously made a decision not to do it in Paterson.
Okay.
I would.
Councilman Jackson, I have numbers from the county just so I can share with you. On April 11th, which is 9 days ago, the county tested 4,574 individuals. Out of the 4,574 individuals, 1,771 were from the city of Paterson, which is approximately 39% of all tests. And William Paterson, based on the 11th, the numbers are going to be higher, but if you try to use a percentage, chances are the percent. As of 11th, 1,771 out of 4,574, which is about 39%. If you want the positive, 1,082 tested positive, 623 tested negative. During that time, 36 were invalid, 11 is TPN, don't know what that is, 1 is QNS, and 18 is to follow. That was as April 11 from Passaic County, so you gotta get 9 days, but you can get the picture. Approximately 40% of what they're testing is the city of Paterson. Just to give you, I want to share that from my council comment, because I have that was shared. Thanks.
Thank you, Councilman. I will follow up with that, Councilman Jackson.
Thank you very much. So, council members, I'd like to have people hitting me up for the public portion. So, I'm gonna, Madam Clerk?
Yes, Madam President.
How many?
That Ryan gave me maybe 10 minutes ago, Ms. Wahida Mohammed, was one person at this point.
Okay, can you
let me check with him on the other side to see if he has any.
Okay, very good.
Give me a second.
Council President, in the meantime, we're waiting on, requesting to have a closing statement. At the end of this, when this meeting is going to wrap up, a minute or two to give a closing statement, and I'm requesting that.
Dr. Prasad, there's something that you seem to not understand. And, speaking over me and saying that I'm disrespectful, but the one that's being disrespectful is you. Because when I'm speaking to you, I have the authority, okay, to speak. And even when you're speaking, all I'm doing is asking certain questions. So when we're done, okay, I will allow you to speak.
Okay, Council President, are we ready?
Yes, okay, so the public portion is now open?
Yes. And if the only speaker we have is Ms. Mohammed Wahida, and Ryan is going to connect her in a couple, maybe a minute or so. Ryan, you may go ahead if you can hear me.
Is anyone allowed to call at this moment, Council President?
No, you have to, when she gave out the number, and she gave
out the number like 2 hours ago. Who's gonna stay on the phone waiting to be connected for 2 hours?
Okay, so I'm with you, all right. So if anyone that's watching wants to call in,
We should give like 3 minutes after we announce closing action, and then see what comes in 3 minutes.
okay.
Okay, you can talk.
Madam Clerk?
Yes, Chief, if
Hello?
Yes. Can you put your name for the record?
Can you hear me?
Yes, I can hear you.
Okay. Thank you so much, Council President. We are sitting here on pins and needles because, like you, we want to hear numbers also. So I really appreciate the fact that I don't know where Councilman Alvin got his numbers from, but it's a lesson that somebody got some numbers, because it makes no sense to us when we sit and listen to the report of what is happening in this area, and then we don't know where the numbers are in Paterson, where the hot spots are, where the most deaths are happening. So we're sitting here like sitting ducks in these buildings, and yes, somebody can tell the director anything they want about they cleaning these buildings 24/7 or 5 times a day or whatever. That's not happening. And in some of these buildings where they don't have security, people are walking in and out of here, just like it's a revolving door. So don't sit and listen to people telling you anything. We need to have proof that things are happening
that they are looking out for us. Because the seniors, we are in a trapped situation. So I really appreciate the fact that, as particularly the fire chief that was talking about them working and the rest of was talking about trying to do something to help us. It really helps to know that you are doing something, that you really do understand that we are here and that we are most vulnerable. So I really appreciate that. And please, by all means, don't let up on getting the numbers so that we will know what's happening in the city, because it is not a joke. And too many people have really not taken it serious enough. And you're right, they're out there like it's the same date in July that it was last year. It's not. But we have to know that you all are really looking out for us, because some of us can't look out for ourselves. So I really appreciate that. So we're waiting too with you to hear the numbers, because I do know some people that have recovered. I do know some people that are still hospitalized, but we are not understanding or getting the understanding of where the deaths are taking place. But we know people are dying. But where we have no clue as to what that number looks like. So please continue to do what you're doing. And if people can't stand the heat, they can get out the kitchen. Thank you.
Thank you very much, Mrs. Mohammed. Madam Clerk, is anyone else? A few more minutes.
Yeah, Council President Ryan said give like a couple minutes to see if anyone is recording. So just bear with us a few minutes. Maybe.
Okay.
Sorry, so.
Can you repeat the number again?
Yes, I will. It's
the call number?
Yes, okay. So 973 321 1579 and ID code 711 680 0071. I repeat, 973 321 1579. The ID code is 711 680 0071. Okay, let's see if there's anyone else. Is there anyone else, Ryan?
Madam Clerk?
Yes, we have one more speaker.
Okay, very well.
Says, I think it's Ramon Jaquin. Ryan, go ahead. Ramon Jaquin. I think it's Ramon.
Okay.
Okay, Ryan, can you try to put him through? Give us a second for him to get answers.
Hello?
Good evening, council members. Good evening, Madam Clerk. Good evening, audience. My name is Ramon Joaquin. The reason I call is because I want to voice a concern, and a very dire one. The public have been live saying that the location of 199 Carroll Street have been visited by officials of the health department, including the councilman that's right there right now. It's a lie. I've been in contact with many of the seniors that are actually panicking. I want to put the word panicking because at this point, all they're seeing are people with hazmat suits coming in and out of those apartments. people are sick and people are dying, and no one is willing to do anything about it. At this point, I've been in contact with a few of our council members to try to see if we could do something about it and try to help the situation at 199 County. At this point, I've also contacted the state because, as they have been saying, it's been a while. No one has been on those buildings to try to disinfect. No one has been there to try to help them. They are in a very, very, very dire situation. At this point, I'm putting all politics aside. It is time to act. It's time to go and do something for the seniors. These are the most vulnerable people that we have in the city of Paterson. The most vulnerable work, able to contract COVID-19, and we should do something about them first. So put politics aside, and let's start thinking about our seniors before we even have a dire situation worse than what we have now in those buildings. What you guys should do is actually try to go out there and try to disinfect those buildings because that's what they want. They want to see visibility. They want to see that they're actually being taken care of, being cared to have those basic necessities being taken care of. Not to put politics in the middle of a pandemic. And thank you for your time. Thank you for actually voicing, let me voice this concern. Again, it's just a straight up lie what the councilman was saying that he had visited that pizza numerous times with house official, when he knows that he have not even stepped foot that even into the corner of 189 Carroll Street. Let's be honest, councilman, and let's do the right thing for our seniors.
Director Castillo.
I just want to be very clear. I don't think at any point we said that health officials have walked into there. They're not city-owned buildings. We either have the housing authority or they're privately owned buildings. So we have worked in partnerships with the buildings and are working in partnership with the administration. And we're going to, move forward. I was just talking to Corporation Counsel offline, trying to figure out the best ways to move forward and get this reporting from these buildings. But the Department of Human Services, Health and Human Services, have partnered with these buildings. I know Dr. Paul has spoken to a lot of the administration, given them information, and answered some questions, and we've tried to partner with them to regulate entrances and cleaning. But we can definitely do more, and I will get on the phone with the Housing Authority as well as try to rally up all the administrations from each one of these privately owned buildings to see what else we can do for seniors. And just like Chief McDermott did say, through this partnership, hopefully we'll have the ability to, as we've been doing, providing the food for a lot of these buildings, but as well as to get medical personnel in some of these buildings as well. We are just waiting for CDC to send us some medically trained RNs, LPNs, and medical doctors in order to help and support some of this screening process. We can't be their primary doctor, but we can support in some screening and answer some questions. But this is all through the partnership with the buildings because we can't make those decisions.
And I think one of the most important things too is also that we have to continue with the campaign that, social distancing is very important. And the common sense, that piece is something we have to hammer constantly, even within our seniors, some of people think, oh, well, I haven't stepped out of my house for 7 days, all of a sudden now, okay, let me step out, and then, you don't have a mask, you don't have gloves. So we have to continue the preventive measures, and there has to be a more aggressive, and I keep saying a more aggressive campaign within those buildings, within our seniors, and throughout the entire city, but within our seniors are the most vulnerable, and I get so many calls of seniors calling me from all over, just afraid of even stepping out of their apartment.
Yep, and that's why Chief McDermott and Deputy Chief Harnett were working on trying to get all of our senior masks and gloves. I was telling them not to go out and to social distancing, but some want to go out, just like my grandma, she's in one of his buildings, and she's like, I can do things on my own. So even though we're educating, we're going to provide those masks as well and gloves. And Chief McDermott's doing a phenomenal job trying to get it all ready for them.
Yes, he is. Thank you so much. Okay, Councilman Velez?
Yes, Council President, as everybody knows, since this pandemic has started, I've been informing the community left and right, especially in the 5th Ward, of everything that's going on, putting up to date the services that getting, the service that the county is giving, even a little bit further. 3 individuals from 199 Carroll Street has passed away. 3 individuals that the director of housing have strictly sent equipment and cleaning service to those apartments because they needed to be cleaned to get it ready for the new tenants. Those individuals have been taking care of 199 Carroll Street. The reason I mentioned 199 Carroll Street because Bobby mentioned it, and when you say about that you're receiving tests that they not being doing, I refer to 199. Those seniors, the president of the residence board, Mrs. Herbert Gordon, have been back and forth with me on the phone with Mrs. Mims and the individual that cleaned that building. Not only that, they have seen me there giving out 200 masks in plastic, not even without plastic, okay, and without doing politics, okay. So let me say this for last but not least. Okay. We really care about the seniors in the 5th Ward for the past 15 years and live in the 5th Ward is Louis Velez. Thank you.
Thank you very much, Councilman. Okay, can I have a motion to close the public portion?
So move. Second.
Move, Madam Clerk, move to close the public portion by Councilman Abdelaziz, second by Councilman Velez. Roll call, Madam Clerk, to close the public portion of the emergency meeting.
Yes, Madam President. Roll call to close the public portion of the emergency meeting. Councilman Abdelaziz?
Yes.
Councilman Jackson?
Yes.
Councilman Kalik?
Yes.
Councilman Rivera?
Yes.
Councilman Velez?
100% yes.
Madam President?
Yes.
I think I have 6 council members present, right?
1.
And 3 absent. The vote is 6 in favor, 3 absent. The public portion is now closed.
Council President.
Okay, thank you very much. Councilman Jackson?
Thank you, Council President. I just want to provide a point of clarity here. I often hear, and I heard Director Castillo talk about the fact that it's not city-owned, or I don't want to put words in her mouth, but you talk about some of the privately owned facilities. But the fact of the matter is, the Director of Housing, which is Mrs. Gorham, is an administrator that falls under the purview of this administration. So all of the responsibilities and the tasks of ensuring the safety, the cleanliness, and the mental health of our seniors definitely falls in the hands of the victim, the Division of Housing. And in fact, I want to make sure that I commend Councilman Velez because I will attest to seeing his diligence there. But many of the buildings that are within the 1st Ward have not gotten that kind of attention. And I will make sure, I will personally find a lawn chair to go sit in various seniors buildings tomorrow. I'm not going to say which one, but I want to see that these elevators and those common areas are being cleaned every hour on the hour, because that's very hard for me to believe, especially when I'm getting calls from people like Ms. Muhammad and who live in these buildings who are saying that they're not getting the attention. I've made my presence limited because of I don't want to be the one to expose our senior residents to the possibility of COVID-19, but there is a responsibility for us to take care of them. And with that being said, that responsibility again falls back on this administration. So just to address some of the last caller who said what you should do, and I think he was implying that the council members should go out and begin to implement certain processes. Well, that, sir, is an administrative function. So, I think we need to understand what it is, how the rules are, and I think by us continuously to allowing these narratives to be shared. The people who we are tasked to take care of are not being taken care of properly. So I'll rest it there, Council President. I think you did a phenomenal job by finally implementing this meeting. But these are the hardline issues that need to be addressed. Councilman Rivera made a point clearly earlier. There's a lot of things that this administration is failing to work with us collaboratively on, and the only ones that are paying the price is the members of our community. In closing, I want to just make this point. And I do acknowledge that there's some things that may possibly our health director could do better, but he is restricted by guidelines of the state, right? But his office, just as my mother's job, who has a great deal of who has a great deal of professionals who are exposed daily, who are implementing tests daily. Not one of her staff members or the people that she takes care of was infected. Only one person who works a part-time job someplace else was infected in the health department. And these are people that are exposed every day to the virus. Yet the entire mayor's office has been closed and quarantined because everyone there was exposed. And at our last meeting, the VA made a statement that the mayor's office was to remain open. Yet my concern is that the members of the clerk's office are there left alone in City Hall while the entire office of the mayor was in fact shut down, because the mayor himself exposed his office to it and everybody else is working from home. So I want to know, leading into tomorrow's meeting, what is going to be done for the other members of this administration or to the employees of the city, and particularly the clerk's office, and why haven't the provisions been made for them to work from home as well? Because everyone's safety should be important. It should not be only certain members don't have to, come to work and don't have to come into the building, still being paid full salaries, and yet these young ladies who are being paid far less than these other individuals are being told that they don't have a choice, but they have to come to work. So, I have a lot of concerns, Council President. Again, thank you for putting this together, the opportunity.
Okay, thank you very much, Councilman Jackson. Councilman Rivera.
So, Councilman Jackson, you and I have been on the same page often regarding the function of the authorities that the council has set up in the past. So, if a resident, what I stated previously was that if we hear concerns from a building that's operated by the housing authority, and our administration is not doing the due diligence to make sure that those people are being treated fairly, then it is the council's, responsibility to hold the administration accountable, and that housing authority, right, that authority that the council created in the past, to reach out to them and address the concern of those residents. Now, I understand that Joaquin called in, but I also spoke to the president of that 199 Carroll Street, and she basically stated that the place is a mess. So all I'm asking is that the administration, goes in and to have a conversation with Ms. Gordon, or maybe, it was 2 months ago, Councilman Jackson, that you recommended that we bring in the housing authority director to have a conversation with her regarding other matters. But from time to time, we need to make it a point to have that conversation, because the same way we created those entities, the same way we could dissolve them and bring them in as a department. I don't know if we want to do that now, though, right? With this department, with this administration, but it is a possibility. We have that power and that authority. So I don't want to sound like a bully, but we can't continue to do business in this city the same way forever. And people need to understand that there's consequences, and they need to treat our people better. That's all I gotta say. And I'm sure you agree with me, Councilman. But again, yeah, I just don't need the administration to tell me that they have been doing this and this and that, when I have the president of 199 Carroll telling me that no, that's not true.
Yeah.
So,
Thank you. Thank you, Councilmember Rivera. And you're right, each one of us gets addressed, and, Councilmember Rivera is at large. So everyone calls in. I'm at large. Councilwoman Mims is at large. So we get a brunt of calls. And I'm sure that the other rest of the council members, they get their constituents from their wards, but also get calls from others as well. So I want to thank you. Before we close the meeting, I'm going to have Dr. Prasad quickly do a closing response, and then we're closing this meeting.
Thank you very much, Council President. I want to thank all the council members, for this first, what I would say, an inaugural Board of Health meeting. It is an inaugural Board of Health meeting. Also, thank the mayor for allowing this to go forward. I think there's a lot of takeaways from this meeting. I regret obviously this meeting was very contentious. And one of the reasons why I think it's contentious is because we're in a pandemic that no individual, no organization, no government in this world could have prepared for. And we have to understand that. And I understand what's going on in Paterson. And most of you know why I say I understand what's going on in Paterson. I'm here. I've been accessible to all the council members. I've been accessible to every department head. I've been accessible to every division head. Whenever there is someone that tests positive in the city within a department, I talk to them myself. Sometimes I do the initial interview, quickly on the phone, and do some of the contact tracing and decide how we're going to move forward. Day, night, any hour in the night, any hour in the day, we're here for that. But I think one thing that I think one of the issues why this meeting was a little contentious also is that sometimes people don't understand the role of a public health department. And sometimes, in times like these, they look upon the health department to do more and more. But know that any health department in this state of New Jersey has authority from the state of New Jersey. And a health department does not function on its own. All our programs are guided by the State Department of Health. I have a lot of respect for the State Department of Health because there are a lot of professionals there. As a professional in my field, I respect them and they respect me. But I stay within the guidelines of the State Health Department, and I respect their guidelines because it's guided by the science. And sometimes I understand every one of us can get emotional, especially when we see death and destruction around us. With this pandemic, there are two issues. We're in a public health crisis and we're in an economic crisis. So that's a double whammy. Nobody could have prepared for this. But I can tell you, one thing I'm very, very confident about, very confident, and you talk to the county, they will tell you the same thing. You talk to the state, they will tell you the same thing. Our team, and before I go there, I want to mention one thing. Despite you having a pandemic, I have not cut the services that we offer to the city of Paterson. Some of those same people in the strike team double up and also provide that services at night and off hours. We have not cut. Our STD clinic is still going. When other cities, big and larger cities, cut their STD services, patients were showing up here to my clinic. And I said, you know what, I've made a choice. And choice I make, and as I say, I consult with the state for almost everything. And I called the state and I said, state, I can only provide services to the city of Paterson during this pandemic. I cannot provide services to other larger cities that I think should have their clinic open. But I'm not here to judge other cities. I'm here to talk about what the city of Paterson, what the city of Paterson Health Department is doing. We have kept all those clinics open. We've kept we cannot close our TB clinic We cannot have people walking around with TB in Paterson. We don't want to create another epidemic. We cannot, I'm not close my clinic to immunizations for children that need it. I'm not close my clinic to sexually transmitted disease, HIV, and pre-exposure prophylaxis, so that we don't end up in another epidemic when we get out of one. And I want the city of Paterson to hear this. The reason why we can do this is because the city of Paterson health department has the capabilities that most other health departments in this state does not have. We want
can you please wrap up?
Okay, I'm wrapping up. Sometimes I get very passionate speaking of health department because my strength, I owe my strength to my team that I have. And I have a support team that is second to none, not only in COVID response, but in many, many areas. We have the capabilities that almost most health departments do not have. Most county health departments do not have. We have those capabilities. Councilman Jackson alluded to some, but I know we cannot get everything in one meeting. And I've attended a lot of Board of Health meetings for other counties. A Board of Health meeting takes a different format, where there are questions, and I can answer or I can provide public health advice. And if I don't know it, I will go and get the answers. I'm sorry that this tonight's meeting took this format. But the one thing I'm going to say is that we need to be very, very clear that the City of Paterson Health Department, and in closing, I want to say that if I don't say this, I will not be able to sleep properly tonight. I want to say something very, very clearly. And I'm not playing politics here. I'm not a politician. I'm a straight shooter. That's who I am. Very, very straight. And those who know me well know I'm a straight shooter. I want to say that I had the full support of the mayor of this town, Mayor Sayek. And I always say, sometimes I say it jokingly that he's leading from the front. But I must tell you, he is. I am very impressed because Mayor Sayek and myself and we sat in virtual sessions with the Bloomberg School of Public Health, with Harvard, and with Johns Hopkins University, week after week, to know what's going on, to understand what's going on, and the mayor is very knowledgeable. I cannot make comments on political decisions. Or the mayor, he is tasked with doing that. He can explain himself. I cannot explain for the mayor. That's not my task. But know that this mayor has been in the front. When it comes to public health education and marketing public health, we've been in the forefront doing this more than any other city. We've had numerous sessions. We've had numerous live sessions right in front of our electronic billboard. Right here, promoting our strike team to reassure Paterson that the task that we are tasked.
Dr. Prasad, you're now almost 8 minutes. I asked you to please.
In closing, I want to say for the task that the responsibility we have given, vested in the legal authority by the legal authority of the state, we are performing that task. I'm very, very admirable. And just because I can say, because I have an A team in Paterson. I have the best team in Paterson. I will stand behind them. I can prove it in words, deed, and action. I will stand behind my team. I have the best trained people in
Thank you very much, Dr. Prasad.
Yes.
Thank you. Thank you very much. So for everyone out there, first and foremost, let it be known, and to all the employees, those that are part of the strike team, that no one is questioning your work and your worth. I have the utmost respect for everyone, even for you, Dr. Prasad. I told you from the beginning, don't take this personal. I have the right, just like you have a responsibility, I have a responsibility. I was elected by the people of Paterson. Therefore, I have to respond to them. When I get the phone calls, okay, when I get the seniors calling me, when I get parents calling me saying, what am I going to do? My child is sick. Okay, I, for one, was one of those who was very worried when I had my son sick. So all I'm saying to everyone here, just like you're passionate, Dr. Prasad, so am I. And the unfortunate thing here is to take offense to asking questions or to making statements that everything is out of my jurisdiction. All I'm asking is I want to see my health officer go out there and that I feel that he has our back. Okay, not tell me I can't do that, or just not answer questions. Okay, I asked you the same thing, and I've been asking for this and sounding this alarm for months, and I'll never forget your statement to me in social media. You went and said that I was misinforming the community when I was stating and saying we need to have preventive measures put in place back in February, and I can document it all. And in our text messages to one another, I have documentation to show the community the proof of what I was asking for. So if today we're here and we held this meeting today, yes, I have to commend Councilman Jackson because he has been asking for us to meet as the Board of Health. And obviously, Councilman Velez was right there as well, and everyone else. So not one person does this. We as a body, a collective body, do this. Yes, it is true. No one knew this was coming. But let me tell you something. There were alarms out there since December. There were alarms out there in January. But we're here now. And all I'm asking is for us to be able to communicate and be more clear with our community in giving the correct data. If we have a chief innovation officer, if we have a data officer, someone who's putting that information on the dashboards, let it be precise. Let it be accurate. And when I say accurate, let it be, there can't be an off number. And I'm going to continue to stand by that we can't, the county can't be reporting a number for Paterson and that the city is reporting another number and it not match, that it be 300, 400. I can understand if it's 10, 15, I get that, but not in the hundreds. That's when I start questioning what's going on, okay? So community, I just need you to know that, we are here as a council to be able to bring forth and collaborate with the administration to protect our citizens of the city of Paterson. I want to thank you, Dr. Ford, thank you to the health department, Ocean Castillo. Today we really didn't go into you, but definitely we have questions for you as well. We could do that in our regular council meeting because I also do get a lot of people to question, not just, don't tell me the process, but give me the actual plan. And then what are the metrics that we're using and what are going to be the outcomes? What are we expecting from that? So that is to be corrected. To our corporation council, you're there, correct? Corporation council?
Mommy, I apologize. I am here.
Okay, very well. So corporation council, I know that you've heard a lot of what's been said today. Okay, I do I know Madam Clerk is on here, and I know that there were certain things that were directed directly to the office. I don't really want to discuss personnel matters on this on live, but I do want us to really address the concerns if we have certain employees who are not feeling well or not feeling safe, that we work something out where there can be a rotation schedule or something to that nature. So if that's something that we can address outside of here. I don't want that what Councilman Jackson has said for it to go on deaf ears. I think we're all hearing the same thing. Okay? And I'm sure that the whole conversations. Huh?
I said I absolutely hear you. Work together and figure out whatever's necessary.
Okay, very well. Chief, thank you so much for everything that you're doing, okay? And listen, at the end of the day, we become passionate, when we believe and we're strong, and, I just want to thank you for giving me this opportunity to run today's meeting. Can I have a motion to close? Move to close the emergency meeting by Councilman Abdelaziz. Do I have a second? Do I have a second? You guys want to close the meeting? Second by Councilman Jackson. Roll call, Madam Clerk, to close the emergency meeting of Monday, April 20th.
Yes, Madam President. Roll call to close the emergency meeting of April 20th, 2020. Councilman Abdelaziz.
So before I go, I just want to once again thank and commend our council president. You saw today her passion when it comes to this pandemic. She has been in the forefront. So, Council President, thank you again for putting this together and leading this conversation. It's truly appreciated. But before we close and before I vote, I do have to state some things to the public. And I like looking at numbers. I like looking at data. And one of the things that I'm going to say on the record, and I think everyone agrees, we need to ramp up testing. We need to ramp up testings, and the delivery of the data is something we have to fix, but it shouldn't delay testing, right? They should be on the same path, but one can't stop because something's messed up. And we heard a lot about the county. And one thing we're going to do, we're not going to get through this alone. We need our partners. You've heard our governor say it throughout the state, throughout the country, right? They need federal help. Well, as a city, we need county help. We need state help. We need federal help. So, Passaic County, I thank you. I thank you for taking on the task in testing Paterson residents. That doesn't mean we should stop testing and Paterson shouldn't open up a test site, but the more test site and the more partners that we have, I commend you. I commend that partnership. Looking at the data, when we say William Paterson is too far or not too far, currently right now, Paterson residents are 40% of what's being tested. The city of Paterson is 29% of the population of Passaic County. So we're exceeding, that's good. Hopefully our census are like that, right, Council President? When we're exceeding our number, but 29% of the population of Passaic County, but we're 40% of the testing. So Passaic County, I thank you. Paterson, let's get a test site. Governor Murphy, you want to open a test site over here? FEMA, bring on the tests. We have to ramp up tests, especially in our communities of color that are getting so affected by this crisis. So we need to really target that. And financially, if I'm not mistaken, that from April 11th, the county has spent probably over $125,000, $150,000 just on test kits for Paterson residents. That's almost $250,000 when you add in the operational of police officers and tents and operational costs. So I thank Passaic County for that partnership. I want to tell the residents of Paterson, keep flooding those gates. I want to see our tests to be 90% of William Paterson, because you know what? We are the county seat. We deserve that service, and I want my residents, I know it's in Wayne, we're the furthest point. The 6th Ward, the south side, is the furthest point to William Paterson. But you know what? I know you guys are going. Continue going. That's a county service that Paterson's entitled to. So I commend the county. And lastly, Council President, I want to put on the record, I've been calling the Chief, Director of Health, Persol, Director Castillo, and BA. We are ready to test our seniors in the 6th Ward. We have the medical staff ready to go. So to my seniors, I have my part. I have professional doctors. Dr. Persol, bring your guidelines or whatever you want to do. These guys are medical doctors. They're on the front lines at William Paterson. We're ready to test our seniors. 283 units. Atlantic Street, Day Street. Let's get the test kits. We'll get the people there to test our seniors. So the ball's in your court. Let's get this done, because that is our most vulnerable population. If we could stop the spread in there, because once we lose control, I don't need to be a doctor to read the news. In our senior population, once it spreads in that building, it's not going to be a site that we're all going to like. You see what happened in Andover, in the Veterans Home in Paramus. Let's stop it. So that's my thing out of this Board of Health, ramp up testing. Let me know how I can help. I'll make the calls that we have to call, and my vote is yes. Council President, thank you again for your due diligence with this.
Thank you. Councilman Jackson?
Thank you, Madam Clerk.
You're welcome.
Council President, blame what's coming on Mr. Abdelaziz. I was going to graciously vote yes and keep it moving, but after that, I cannot. As we all know, Al has spent his entire lifetime of being affiliated as a Democratic Party.
My whole politics.
Mute your microphone, sir. You have your opportunity to speak.
Numbers don't lie, Councilman.
Yeah, numbers don't lie. So out of 1,500 tests of 180,000 residents in the city of Paterson, we're talking about that's something that's good, then I would be completely disappointed. We're talking about certain the thousands of people who have been impacted. Well, we know as the 6th ward being the furthest from the college up in Wayne, with all these great doctors that you have who are willing to volunteer their time, I'm sure the 6th ward doesn't need to have free testing sites. But I can tell you what, there is a great doctor in my community, in the 1st ward. She's been here for decades. She's been servicing the community for decades. She has a great service on Clinton Street and North Main. And guess what? She had to taper down the amount of services that she could provide to my community because the funding that was supposed to have been allocated for Paterson was rerouted to Wayne, which is a completely terrible disservice to the community. So I'm very much so still interested in who exactly was a part of that decision. I'll even go as far as opening email correspondence for the last for those weeks to find out exactly who made the decision, who did not rally or fight for Paterson. Because for me, from my standpoint, the Paterson people who don't have access to health care, and and I know you have a great intentions, Councilman, but as you consistently talk about the segment of the African American community that is impacted the most, I would think that community, because it is impacted the most, and it has been proven not only locally but nationally, that it would be a focus in my areas where that segment of population could be targeted and tested and don't have to reach. Because just today, 3 times a young lady called me who lived in the Triangle Village area who wanted to know a family member of hers that did not have access to testing and they don't have access to transportation. And and I would love to do all of the things that the councilman of the 5th ward does, and personally go out there and put himself in harm's way. I have young children at home, and I can't do all of the things all of the time. And this is the task that the administration should have made sure that Paterson residents was not put second. Yes, 40% of the population, or 40% of those tested was Paterson people. I think that's admirable, but I think the numbers would have been a lot greater had the test been done in Paterson. And when we look at the population, the numbers in Wayne who have access to health care, who have transportation, who probably decided not to utilize that test site because they have other alternatives, the numbers, I'm sure, won't stack up the same. So with that being said, I'll give credit to Director Rodriguez for making making it a little bit easier, because I saw your dog licking you on the side of the face over there, Director Rodriguez. So, yeah, I know he's looking for your attention. You've been on this call far too long, but and I'm checking out how Chief McDermott is somewhere in Florida with the palm trees in the background. But not to make light, Councilman Abdulaziz, you're very much always on target. I would like to have seen, and I know that you would as well, Paterson. I represent Paterson. I don't represent the county. I don't care to be a freeholder. I don't care to be any other elected official. I represent Paterson and Paterson only. I fight for Paterson, and I do have some new shirts. On the back of it, it says "Fighter" for the #1 fighter for the 1st ward. I'll give you one of those, so you could hopefully.
What happened to the advocate?
I'm sorry?
The advocate.
Well,
the advocate shirt.
I'm sure I don't have to explain it to you. You're very well educated. The front says advocate, but another description for fighter. We fight for the rights of our people. So let's continue to fight for what's right for Paterson people only. I commend the county for the work that they do, but that money should have went to Paterson, the most impoverished, the most overcrowded, the city that's always treated second, the city that always takes care of the responsibilities of all the other members of the community. We have yet to look at some of these service providers that also receive this federal and state funding, such as Eva's Village, such as all of these other outlets that should also be providing testing for the people they bring into our community. There's a lot of work that still needs to be done. But Council President, great job on at least initiating the first step with the first inaugural Board of Health meeting. So with that being said, Madam Clerk, I'll rest there until tomorrow night. My vote is yes.
Oh, thank you, Councilman. Councilman Khalid? Councilman Khalid there? Councilman Khalid? Okay, Councilman Rivera?
Yes, I just want to say, I just want to thank Dr. Paul for, meeting with us today. Hopefully we continue to meet. Hopefully we could, address some of our concerns. Maybe we could help you, address some other concerns that you might have as a body. Listen, we're all here because we're all concerned. And we do need to put a plan together to see how we can facilitate some of this testing to some of our residents. Especially the seniors, especially where places where they're all together, where you could just go with a team of people and just facilitate a lot of this testing. We need to have more conversations. Not an expert on the area, but I do hear concerns from the people, and that's all I'm relaying. Their concerns, and I believe, Council President, that we need to continue these discussions. Next time is just have them more organized. And maybe ask us some questions that we'll be discussing before, the administration and Dr. Prasad meet with us. That way we could have some solutions to the problems. At this time, my vote is yes.
Thank you, Councilman. Councilman Perez?
Thank you, Madam Clerk. Council President, first of all, thank you for allowing us a beautiful Monday, beginning of the week. With this special meeting. When I saw this email in the morning, because last night I had to go to bed early, really. It's a lot of stress, there's a lot of calls that we receive. I come in and I commend all the council members that when we go to speak, they take their faces off out of the screen, but that's okay. Councilman Paterson, thank you for coming back. But let me say something. When I speak, I try to speak what I do, and I do it with facts, and I do it with the old intention to serve the community, and that's what the people elect me for, to do that. And when I go out there, I protect myself, and it's hard for us that we are people person to not hug people. Thanks God. For the past month, I have not doing that, being using more of my hands and taking care of myself and making sure practicing social distancing. And it's working. But at the same time, it had not prevent me to call my constituents and to follow with them in every aspect of it. Now, when they say that people have called, and especially 199 Carroll. Meanwhile the conversation was going on, I did call the president of the resident association on that building, 199 Carroll. And you know what they tell me? That they doing calls, political calls, to ask them, what is the condition of the seniors? What is the condition of the elected official going there? What is this and this and that, this and that? It's not time for politics. It's time to get problem resolved. From the 6th of April, that the president of that building, 199 Carroll Street, and not only her, the VP, and not only her, other residents from the area, we've been taking care of the situation of sanitation, That building has 8 floors, okay? And probably a lot of people don't understand that it's almost 200 apartments, okay? I could show you my phone, how many residents that I have, phone number from there, okay? Because I have relation with my seniors. She calls me this past Friday, tell me, thank you, because they've been cleaning the building. So whatever they did a call to get information what we do and not doing for political reason, strike. It's not gonna work. My resident knows that I'm in those buildings, taking this seriously, but if they need me, I will take care of the situation through the phone and let the authority work where they have to work. I had to commend the chief of fire that this week, I believe today, the deputy chief, oh my God, I had his name, you mentioned it before. What is the name of the one that OEM?
Deputy Chief Gardner.
Gardner, yes, Gardner, yes. He's being contacted with the firemen, going to every senior building and handing masks to them. Is that correct, Chief, or not?
He's doing that in concert with Director Castillo.
Correct. See, I find out this because we talk to them, we talk to whoever we have to talk to make sure our seniors are okay. And I have to commend the Director of Human Services, Ochin Castillo. Her responsibility, okay, in including the seniors building, okay, in their plan to give out those boxes of food, because those boxes were supposedly the housing had their own strategy in how to supply food for them, but they include them in the program and they working fine. So I had to comment on that on the director. But last but not least, and I'm not here as an attorney for no one. This meeting it went some kind of okay. I always say that we have an agenda for the beginning, or those questions will be answered out of the TV land, and then the answers and respond will be probably a little bit shorter. But one thing that has to be fair, and this thing, and I wrote it here because it's very important to keep this in mind. From the beginning, and I recall this, when the city tried to lock down the city in March 14 or 13, okay?
16, March 16.
I know, that was gonna be an effective on 16, but they was talking.
No, that's the day he did his executive order, March 16.
16. But they was talking in conversation before the 16 when they was gonna do it. So they decided to take the 16 as a day to start. It's a Monday. Because I recall that I canceled my grand opening on the 14th. I recall that. So what I'm trying to say is that we need to be fair in some statement, and I wrote it here, this administration, and let me tell you something, this administration have been delivered what they could deliver. If they don't have the funding, if they don't have the resources, for me, I think they have done a great job in some aspect, okay, to keep informed the community in some aspect, to keep control and having the fire department out there doing their job, having the police doing their job. We lost members of the police department, and still we have individuals in the fire department sick, and they still try to stay positive in the way they are to deliver their service. Our mayor, and we need to understand, he even got exposed and he got sick, and he's still delivering from his basement. He's been having communication with all of us, those that he calls more than others. I only text him. I don't have the luxury to call him every time. But he have delivering even in his sickness. in his stages of worries. We have to be a little bit compassionate in that. So I just want to say, if you understand the passion that all of us have, we all have that passion. We all have the passion to serve in some people in some capacity, others in other capacities, but we all in this. As you say, Council President, we all in this, and we're not alone. We have to fight it together. But
we're all in this together.
We're all in this together. But we all worry about our seniors. Matter of fact, I'm gonna say a little bit more. I'm worried of those undocumented individuals that do not have a status in the United States. I'm worried about them, that they're afraid to go to a hospital, that they're afraid to talk to an official, that they're afraid to talk to an ambulance, probably because they're afraid about their status here. And you have seen me in my Facebook Live when I talk to them. Don't be afraid that they're not going to call immigration on you. Get help, and get help. The uninsured individual that do not have insurance, those individuals, information that is not disseminated in Spanish, Bangladesh, or Arabic is always in English. We always have to translate a lot of those documents or those information in other language and send it out there to other people so they can understand. But you know what? We all in this, and I pray for everyone, and I will continue praying the same way we hear, Jerry, the same way, I know he's under arrest on that, the same way that we have received the sad notes, trust me, the same way good notes. But when we pray, we want everybody to be involved in the good notes. So thank you, Council President, for allowing me. I know I don't like to speak a lot, but I try to say what is right. And thank you for the administration to allow me at least be part of the solution and not part of the problem. So thank you, Council President.
Thank you very much.
Your vote?
Oh, that will take another half hour. No, I just my vote is yes.
Thank you, Madam President.
So once again, thank you very much, Madam Clerk, and to the council members and to Dr. Prasad and Chief, everyone that's still on this call. This was definitely a meeting that needed to happen. For a long time, we've had to, we were not in compliance. So we're here now, and I just want the community, if you're leaving with anything today, is that you have representatives that are fighting for you, and that we are requesting information that is needed so we can be better helpful and that we can collaborate. This is about a collaboration. This is not about pounding on that one person. This is about collaborating. Now, I do want to put certain things on record, and one is that I need to know for those individuals that work for the city of Paterson that have the measures that are being taken as they quarantine and thankful that if they're well, that, are they being tested before they come back? I want to know if that's something that is being done. So what measures are we taking? And I mean that from the fire department to the police department to the DPW workers and anyone in the city of Paterson that has tested positive and has been out for 14 days, 20 days, when they're coming back, are they being tested and being told, you're clear or not? So I need to know that. That's not to be answered right now.
Madam President, I will let the fire chief answer that because we just discussed this morning about testing and when someone comes back and how they're treated and all of that. Are you on, Chief?
Okay.
Yeah, I'm on.
Is it Chief? Okay, Chief. You know what we talked about this morning.
Did you need an answer, Council President?
No, I didn't. That's why I'm doing my final statement, Director Spazial.
Oh, I'm sorry. I thought you needed an answer. I apologize.
No, that's okay. I said that those answers could be given to me later, okay? And not just to me. It's a collective, it's for the entire body. So, I'm just putting, I want Madam Clerk, I know she's making notes, and I know Melinda's also, he's still there, right? Madam Clerk?
Yes, I'm here.
Okay, no, but I'm saying Melinda's also there, right?
I'm making my notes. Yeah.
Okay, very well. And so, I just lost my train of thought with Jerry.
Sorry about that. I was trying to answer your response.
No.
I
So
thought you
anyway,
wanted,
so
I
in
figured
terms,
the council was together and we'd give you, it wasn't really a long-winded, it would have been a short thing.
so I just want to make sure that, just for the safety of all and for the comfort of all, okay, that there's quite a few who have, tested positive within the different divisions, right? And that, because I also heard something else about, if you're a first responder, your time, is not 14 days or 21 days, it's only 7 days, so, but I don't want to discuss that right now. I know that everyone is different, okay? Because we've had people in ICU and in ventilators, okay, and we just have people that are just having certain symptoms in our home, or people that have been exposed. So I get it that there's different levels. But I do want to understand that better, okay? In terms of our homeless population, all right, I want to see that plan in writing, okay, because that's really important, and what measures we're taking, so that way we can get these individuals, the necessary, help, okay, that they need, to move forward. So, what was the other thing? I still want that report. I think it's important. I'm not gonna stand down on that report, that I feel that the city of Paterson needs to have, more accurate numbers. So I do want to know, one lost life is too much. But the reality is that I feel like some of us downplay the situation just so we're not alarming. And these sounds, these alarms have been going off for a long time, but I feel that some people don't want us to really put out there the seriousness of this. And that's just my personal opinion of what I'm seeing, okay? So not pinpointing on anyone per se, but I just want us to do a better job in giving us accurate numbers, okay? And I think that we can get that done, working together, Dr. Prasad, and again, not putting a lot on his plate, but if he can designate that person, that would be the person to be making the phone calls. Let's get, our numbers, to reflect, what the state and the county reporting. The other thing that I want to say to the community out there is that, I want to apologize for anyone that feels that, I see certain comments. I'm actually getting screenshots of individuals making statements, how, our council meetings are, a crap show and so forth. This was a meeting convened for the Board of Health, and these questions needed to be asked. And I will stand by what's right, and my passion will come out when I need it to. But if you feel offended by that, then my apologies, but I'm here to fight for the people of Paterson, and I will continue to do so. So thank you, council members. Thank you to everyone. Amelinda, I see you. I see you. And Madam Clerk, thank you for putting this together as well today. So, council members, have a good night. I'll see you tomorrow. Tomorrow's a workshop meeting at 6:30. Good night. My vote is yes.
Thank you. The vote is 5 in favor, 4 absent. Emergency meeting of April 20th, 2020 is hereby adjourned. Good night, everyone. Thank you very much.
Good night.
Good night.
Good night, everybody.
You too.
Night, Director.
Good night, everyone.